The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Good day, everyone. My name is Dr. Lalaine Makalalag Tiongson, and I will be your teacher for Preventive Medicine and Public Health Pearls. So let's start. Before we start, I want to introduce to you the members of the Board of Medicine. So here they are. Let's start with Dr. Jody Virgie Dalmachon. She is the chairperson of the Board of Medicine. She's from UP Manila. She graduated in UP-PGH Obstetrics and Gynecology and took up her master's in UP Manila NTTC, Masters of Medical Science and Pharmacoepidemiology. She is also a previous professor of pharmacology and toxicology in the Department of Clinical Epidemiology, and her research interests are maternal and reproductive health, drug safety and epidemiology, bioavailability and bioequivalence studies, health financing, health policy, HIV, medical education, air pollution, and functional food. Now, why am I telling you all this? I'm telling you all this because if they make questions, if she makes questions, she may take questions from topics which she is most familiar with, and those are these. Okay, so if you have extra time, you may want to, read up on these topics. And so that's her. Next off, we have Dr. Eleanor B. Almoro. She's from UP College of Medicine, Obstetrics and Gynecology din siya, and she is from UP College of Pharmacy undergrad. So this is Dr. Eleanor Almoro. Next, we have Dr. Zenaida L. Antonio. She is from UST Medicine, Deputy Director for Medical Services at NKTI, past Chairman of Pediatric Nephrology and NKTI, Pediatric Nephrology. Various research include pediatric transplant, pediatric dialysis, nephrotic syndrome, mesangial proliferative glomerulonephritis in children, nutritional status of pediatric patients less than 16 years old. Next off, we have Dr. Efren C. Laksamana. Dr. Efren is the head of the Eye Institute in St. Luke's Medical Center, PGC. He's also a doctor in philosophy, in education major in educational leadership management in St. Joseph College, master's in business administration from Ateneo, and master's of health services administration in Ateneo, and research includes healthcare management and curriculum development. Next, we have Dr. Martha Nukum. She worked at Veterans Memorial Center as Assistant Chief of Medical Professional Staff. She's Doctor of Medicine in UST, Master's in Health Administration at Ateneo Graduate School of Business, and she's from Ago, La Union. She's also a pulmonologist. So that's Dr. Martha Nukum. We have Joanna V. Remo. Doctora is the chair of the ethics committee of Amang Rodriguez Memorial Medical Center. She was also the medical director of Tarlac Medical Center, and she is a pediatrician. So let's start. This is a branch of medicine that concentrates on keeping people well with the goal of disease prevention and health promotion. So when we talk about disease prevention and health promotion, this is your, all right, preventive medicine. Very good. Guys, the way to study pearls is like this, no? It's usually question and answer with a little bit of background on the topic. So dapat sa pearls, wala na kayong bagong matututunan. It's just pure and simple review. Everything is found in your main handouts, right? Everything is found and taken from your main handouts. This is just supposedly, a review, and you have to answer the questions. Don't wait for the answers. Okay, so answer the questions and then you can watch the videos. Or pwedeng sabay din, but you have to answer quickly. So after you see the question, pwede nyo i-pause. Ganon. But I suggest you answer the questions and then you watch the videos for the answer. Okay, next. Study of factors that influence health of population, the application of epidemiologic findings to decisions in the care of individual patients. This is your clinical epidemiology. Okay, so pag sinabing application ng epidemiologic findings, clinical epidemiology yon. Next. It is a branch of medicine that deals with the study of the causes, distribution, and control of disease in the population. When we talk about causes, distribution, and control, this is your epidemiology. What is the ultimate aim of your epidemiology? Is it A, B, C, or D? So the answer here is letter E, all of the above. It is defined as the study of the uses of and effects of drug in a large number of people. So what is this? This is your pharmacoepidemiology. So pharmacoepidemiology is the study of drugs upon the population. So pharmaco meaning drug, epi is among, and demos is people. So study of drug upon the population. Kasi may logos, which is study. So these are your definition of terms. You have epidemiology, clinical epidemiology, which is basically just the application of your epidemiology, pharmacoepidemiology, which is a study, okay, in a large number of people. And of course, you have your health. I'm pretty sure from first year medicine, I'm memorizing the meaning ng health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And of course, the goal of your preventive medicine is disease prevention and health promotion. Okay, ito, bin-breakdown ko lang yung meaning ng epidemiology kasi mahilig sila sa ganito. When we talk about epidemiology, okay, it is the study. Pag sinabi mong study, pwede siyang scientific, systematic, data-driven. When we talk about distribution, ito yung mga frequency and pattern. So kung may makita ka sa exam, mga frequency pattern, tapos tinanong, ano siya, study ba siya, distribution, determinants, application. So sabi mo, distribution yan. Kasi it has frequency and pattern. Pag tinanong naman like causes, risk factor, determinants yon. Okay, so of health-related states and events, not just diseases in specified population, patient and community individuals viewed collectively, and the application, okay, so yan yung breakdown meaning ng iyong epidemiology. This theory of disease causation states that disease is caused by unhealthy or polluted vapors rising from the ground. So what is this theory? This is your miasmatic theory. According to this theory, there are 4 bodily fluids that determine a person's temperament, and an imbalance leads to a certain illness. So what is this? A humoral theory. So let me show you some famous people in epidemiology, okay, in preventive medicine. So we have Hippocrates. Hippocrates attempted to explain disease occurrence from a rational rather than a supernatural viewpoint. Kasi before, di ba, parang, uy, pag masama kang tao, magkakasakit ka. Okay? So, hindi rational yon. Hippocrates was one of the first people who tried to change that. He had an essay on air, waters, and places, and he suggested that environmental and host factors such as behavior might influence the development of disease. Okay, siya din yung nagsabi ng 4 humors, which is your blood, yellow bile, black bile, and phlegm. Okay? So, yan yung humoral theory by Hippocrates. Sinasabi lang, basically, if there is an imbalance in the fluids, it causes illness. What were the treatments for these imbalances? Well, bloodletting, like your phlebotomy or leeches, cutting a vein, ganyan. And purging patients are given emetics para mag-vomit. And of course, laxatives also used to empty the bowel. So those were the treatments nung araw. John Grant. John Grant was a London haberdasher. Okay, yung haberdasher yung parang nagtitinda ng mga sewing materials, buttons, ribbons, zippers, ganyan. So, councilman din siya. He published a landmark analysis of mortality in 1662. He quantified pattern of birth, deaths, and disease occurrences, noting disparities between male and females. So, sinabi ni John Grant na mataas yung infant mortality in the urban, okay, versus yung mga rural differences, malaki. And there was also seasonal variation. Like, for example, in the winter, mas marami namamatay versus in the summer. Parang ganyan. So he published all of that in the analysis of mortality data in 1662. So William Farr, 1800s, William Farr built upon Grant's work by systematically collecting and analyzing Britain's mortality statistics. Farr is considered the father of modern vital statistics and surveillance. Now, he developed many of the basic practices used today in vital statistics and disease classification. He also worked on cholera. So, William Farr, he concentrated his efforts on collecting vital statistics. Yung, paano ba ginagawa yun? Assembling, evaluating, okay, those data, and reporting them to responsible health authorities and the general public. So, yan. Tapos, mapapansin nyo, galing din siyang Britain. Okay? So, bakit? Because before, sa UK, sa London, doon maraming nag-aaral ng medicine or not just medicine, but, you know, so-called epidemiology. Next. So, we have Ignace Philip Simonwells. He sinabi ni Philip Simonwells na first clinics by physicians and medical students had higher rates of puerperal fever than second clinics handled by midwives. So ano ibig sabihin nito? Yung first clinics kasi, mga doktor yung mga nandun. Yung isa naman handled by midwives, yung second clinics. Now, he observed, okay, these doctors. And you know what he observed? He observed that these doctors, for example, galing ng cadaver cutting. After that, they went and did, let's say, internal examination in pregnant patients. O, diba? As in, from a morgue, diretso na agad. Walang hugas-hugas ng kamay because hindi pa naman uso nung araw yung aseptic technique. So, what did Philip Simonwells do? He implemented a policy that physicians and medical students should wash the hands thoroughly before touching a pregnant patient. And as a result, puerperal fever decreased from 12.2 to 2.4%. So, imagine mo yun, napababa niya yung puerperal fever. So, he was called the savior of mothers. Okay? And, by the way, head washing was done with chlorinated lime solution. Okay, so yeah, chlorinated lime solution. Now, what happened to Philip Simonwells? He actually was committed into an asylum because he had a nervous breakdown because most of the doctors in his time were offended by what he did. O, diba? Nasaktan sila. So, they were offended and Philip Simonwells had a nervous breakdown and he was committed into an asylum where he died 14 days later, And the acceptance of this hand washing was only accepted years after his death. Okay? Kasi na-offend nga sila, diba? So, years after his death, saka lang naging widely accepted. Okay, let's go to Edward Jenner. Edward Jenner is best known for smallpox, diba? So when you hear Edward Jenner, nare-relate mo talaga sa smallpox. So smallpox was quite a problem during his time. Milkmaids who have had cowpox were somewhat protected from smallpox. So ito yung na-observe ni Edward Jenner. Vaccination against smallpox instead of variolation. Ito yung ginawa niya. Na sabi niya, mas okay ang vaccination versus variolation. So ano ba yung variolation? This is the grinding of scabs from patients with mild form of the smallpox and then blowing them into the nose of non-immune individuals. So imagine mo yun, kukuha sila ng scab, dudurugin, tapos ipapaamoy sa'yo. Diba? So that was what they did before vaccination. So Edward Jenner was also dubbed as the father of immunology. Okay, so this is what happened. Sarah Nilms, a milkmaid, was infected with cowpox. James Phipps, this is the son of their gardener. He was 8 years old. He was inoculated with cowpox pus from Nilms. Okay, so guys, okay, mabigla. This was before the advent of what do you call this, mga, mga nagbabantay sa mga research, okay? So, walang ganun nung araw. So, he was inoculated with cowpox pus from Nilms, and Phipps falls ill with a mild case of cowpox. Now, scabs were collected from a smallpox patient, and Phipps was inoculated with the scabs of smallpox patients. Phipps is seemingly unaffected. Okay? Hence, sabi ni Edward Jenner, wow, protection is complete. All right. So, what did he do after that to further prove his theory that protection is complete? He did it again. He inoculated Phipps a second time with scabs from a smallpox patient. And you know what? Phipps didn't develop smallpox, diba? So, yeah, that is Edward Jenner's contribution. So I have a question for you guys. In terms of vaccine use during smallpox eradication, also provided protection against monkeypox. So yung mga vaccine ba, they provide protection against monkeypox, or also called your mpox? Yes or no? True or false? Okay, so the answer there is true. Okay, so the answer is true. Why? Because mpox and smallpox, they are both enveloped dsDNA virus from the orthopox virus genus, and they are from the family of Poxviridae. So, itong genus, yan, Geneus, ano bang pronunciation yan? I'm not quite sure. 2 doses yan ng intradermal vaccine given 4 weeks apart for your mpox. Yan. So, remember, vaccines used during smallpox eradication also provided protection against mpox or monkeypox. Hindi na kasi tinatawag ng monkeypox ngayon. The correct term is mpox. Best given intradermally, okay, so forearm. When does the vaccine for mpox start to work? You can start to have an immune response, but it takes 2 weeks after the second dose to be most protected. Okay? How does mpox spread? It spreads through person to person via yung lesions. So, nadampi ka lang, magkaka-mpox ka na. Respiratory droplets or secretions, fomites with bodily fluids, scratched or bitten by an infected animal. So, mpox naman is a self-limiting disease, usually 2 to 4 weeks, no? And yun it spreads person to person. So, mpox is an enveloped dsDNA virus from the orthopox virus genus in the family Poxviridae. Meron siyang 2 genetic clades na tinatawag. Clade 1 and clade 2, para madaling tandaan. Pero syempre, sa exam, medyo pahihirapan nila kayo. Yung clade 1 is also called your Congo Basin or your Central Africa. Okay, Congo Basin or Central Africa, aka clade 1. Pag clade 2 naman, this is your West Africa. So, hindi siya central, nasa west siya. This is your clade 2, and it's divided into clade 2A and clade 2B. Now, the clade 2B, siya yung nag-cause ng 2022 outbreak. Diba, kung maririnig nyo, some people contracted mpox during 2022, and that was due to the clade 2B. Okay, another famous person is Jon Snow. Now, when they asked this question, it was the height of Game of Thrones. So everybody was like, who is Jon Snow? He's king in the north. Okay, so but Jon Snow from 1854 was the father of field epidemiology. Now, he's also an anesthesiologist from London. He conducted studies of cholera outbreaks both to discover the cause of disease and to prevent its recurrence. Descriptive epidemiology, to hypothesis generation, to hypothesis testing. Yan yung ginawa niya. To application. Oh, so, ang dami niyang ginawa. In 1854, nagkaroon ng epidemic ng cholera sa Golden Square ng London. Now, you have to remember, Golden Square ng London, it was a bustling town before. Tapos, London didn't have the best, what do you call it, sewage system, okay? Best water supply, best water sewage. So, marami nagkaroon ng cholera that time. So, what did John Snow do? He created a spot map. Now, the spot map more or less looked like this. Okay, so it's just a picture of the houses with tiny spots, and each spot is one person that has cholera. Okay? Now, kung mapapansin nyo, there are 4 pumps around London, central London to. And pump A has a lot of people around it that have, what do you call this, cholera. Kung mapapansin nyo, okay, around pump A, maraming may cholera versus pump B, C, and D. Okay, wala masyado may cholera dun sa area na malapit dun sa mga pumps na yun. Okay? Now, John Snow believed that the water was the source of infection for cholera. Sabi niya, oh, that's coming from the water. But he wasn't sure. So what did he do? He marked the location of the water pumps on his spot map. And then he looked for a relationship between the distribution of households with cases of cholera and the location of the pumps. Now, he noticed more case household clustered around pump A, which was the Broad Street pump, versus those around pump B or pump C. And kung mapapansin nyo, sa spot map natin, there was no case of cholera, okay, in the 2 block area just east of the Broad Street pump. Now, look at that. Oh, diba? Napansin nyo ba yon? Now, what is the explanation? Bakit daw walang cholera dyan sa 2 blocks na yan? Well, dyan sa 2 blocks na yan, Snow found that there was a brewery, a beer brewery, located there, and the brewery had a deep well. Now, the deep well on the premise, yung mga brewery workers, they got their water from this well, this deep well. And they also received a daily portion of malt liquor. Right. So the access to these uncontaminated water rations could explain why none of the brewery's employees contracted the cholera. Okay, so hindi sila nagkasakit because they had access to a deep well which was clean. Now, to confirm the consumption of water from the Broad Street pump was one of the common factor among the cholera patients. What did John Snow do? Okay, so after he presented his findings to the municipal officials, the handle of the pump, yung pump A, was removed. And you know what happened? The outbreak ended. O, diba? Ganun kasimple lang. Tinanggal yung handle, so hindi na magamit yung water pump, and the outbreak ended. So the site of the pump is now marked by a plaque mounted on the wall outside the appropriately named John Snow Pub. So guys, if you ever visit London, okay, in central London, hanapin nyo yung John Snow Pub. Next, Charles Stewart Harris. He is an English virologist and academic. First, a full-time professor of medicine at the University of Sheffield. So ano bang ginawa ni Stewart Harris, Doc? So, he identified the difference between influenza virus and the common cold. All right, so that is his contribution. He also has some contribution in research of polio. Okay, the first OPV underwent trials at Sheffield. And of course, he received the Rockefeller Scholarship. Yeah, so John Oxford. So Professor John Oxford was a student of Harris. He's an English virologist. He is the leading expert on influenza, including bird flu and the 1918 Spanish influenza. And of course, he is also interested in HIV/AIDS. He co-authored Influenza, the Virus and the Disease, and Human Virology, a text for students of medicine, dentistry, and microbiology. So, yeah. Now we have Dr. Anthony Fauci. He is the director of the National Institute of Allergy and Infectious Diseases at the NIH since 1984 to present. So he is an expert in immunology, basic and applied research to prevent, diagnose, and treat established infections such as HIV/AIDS, respiratory infections, diarrheal diseases, tuberculosis, and malaria, as well as emerging diseases such as Ebola and Zika. So he also worked on the coronavirus task force, Ebola, HIV/AIDS epidemic. So that's Dr. Anthony Fauci. Okay, stretching, guys. Match the following terms. So remember, I gave you terms kanina, distribution, determinants, and application. So kindly answer this. Okay, and if you're done answering, I will now give you the answer. So number 1, comparing food histories between persons with staphylococcus food poisoning and those without. This is letter B, determinants. If you compare frequency of brain cancer among anatomists with frequency in the general population, this is letter B pa rin, determinants. If you mark on a map the residences of all children born with birth defects within 2 miles of a hazardous waste site, so nag-create ka ng spot map, this is very good. Distribution, kasi gawa ka ng distribution, di ba? If you graph the number of cases of congenital syphilis by year for the country, graph again, this is distribution. Recommended that close contacts of child recently reported with meningococcal meningitis receive rifampin. This is application kasi treatment siya, di ba? And if you tabulate the frequency of clinical signs, symptoms, and laboratory findings among children with chickenpox in Cincinnati, Ohio, this is very good distribution. So kung mapapansin nyo, no? Distribution, okay? Pagka mayroong mga comparing, distribution, pag mayroong mga marking, okay? Graphing, tabulation. Pag mayroong mga comparing, this is your determinants. And of course, application pag may mga treatment. Question, what is the virus that caused the 1918 pandemic that caused 1/3 of the population, approximately 500 million, to become infected with a mortality of at least 50 million? So ano yan? That was your H1N1 virus, diba? H1N1 virus. So itong H5N1, guys, if you're familiar with it, if you were born na. Okay, that was in 1997. Okay, that was the avian flu. 1997 in Hong Kong, H5N1. So, nagkaroon din ng scare, but hindi kasi siya transmissible from person to person. So, yun. This Yersinia pestis, this is your bubonic plague or Black Death. I will discuss that later. So, yun yung, kung ma-remember nyo, yung mga naka-mask, naka-ganon. Yun yung mask nung araw. I'll show you a picture later. So what was the virus that caused the 1997 avian flu in Hong Kong 23 years ago? Oh my God. Oh, alam nyo na to. What is the virus? This is your H5N1. Okay. Timeline of pandemics based on CDC. So let's start from the past. 1918 H1N1, the influenza pandemic that lasted approximately 2 years, diba? The H2N2 is 1957. The H3N2 was in 1968. 2009, you had your H1N1, which, took like 60.8 million which had like 60.8 million cases. And of course, in 2019, how can you forget, was the COVID or the SARS SARS variant 2. Okay. I know. Yeah. Okay, so this is the influenza milestone. All right. It's just good to know that it took them approximately 88 years to fully sequence the 1918 virus. Imagine niyo yun, 88 years. Now, if it took them approximately 87 to 88 years, okay, yung 2019 na virus, all right, this one, the COVID, it didn't take them more than a year. Diba? Why? Because of course our technology is, much better. So yeah. So 1918, a lot of people had the flu. Okay. Next. So this is your Yersinia pestis, everyone. So the life cycle of your Yersinia pestis: eggs shed by a female into the environment, eggs hatch into larvae, larvae form pupa, and adults hatch from the pupa. And this is your diagnostic stage, your adult, and the infective stage also. So it infects, basically anything: dogs, cats, rodents such as your mice, and of course humans. Okay, so this is your Yersinia pestis. I'm not sure if you remember this, but it's called bubonic plague before. It's characterized by acute fever, headache, and chills with swollen lymph nodes called bubone. Swollen lymph nodes everywhere. Okay, this is due to a bite of a flea and localized to the nearest lymph nodes. If not treated, can spread to the rest of the body. But this does not spread person to person. Okay. Then we also have your septicemic plaque, characterized by fever, chills, abdominal pain, shock, and bleeding into the skin and organs. Guys, pag sinabing septicemic, from the root word, okay, bleeding into the skin and organs. The skin and surrounding tissue may become necrotic and turn black. So kung mapapansin nyo, yan, meron siyang black. Kaya din siya tinawag na black plague, diba? It is transmissible from a flea bite or handling infected animals or infected carcasses. So, yan siya. So, this was a breathing mask. Okay, yung ganyan itsura. It was a breathing mask. Kasi yung mask natin flat, diba? But before that was, their mask. So the third, another stage is called the pneumonic plaque. Okay, the pneumonic plague. Fever, chills, weakness, and rapid onset of pneumonia. So dito naman, meron kang chest pain, cough, and bloody mucus. So yung kanina, di ba, blood, okay, septicemia siya. The first one is bubonic, bubones, okay, lymph node swelling. Ito, this is the lungs, okay, cough. This is due to inhaling infectious droplets or from untreated bubonic or septicemic infection. So the first and second can lead to the third. Okay, it may occur separately or in combination. So this is your gram-negative bacterium from the bite of an infected flea. So that is your Black Death or your Yersinia pestis. Okay, so let's go to your core epidemiologic principles or functions. So first off, we have your public health surveillance. Second is your field investigation. Third, analytic studies. Fourth, evaluation. And your fifth is linkages. Your policy development, they also include it, but mostly it's just the 5 core epidemiologic principles. So first, we go off to public health surveillance. So from the French word sur, which means over, and veiller, which is to watch, it's overwatch. Okay, so public health surveillance is the ongoing, systematic collection, analysis, interpretation, and dissemination of health data to help guide public health decisions making and action. So ongoing system siya. Okay, so from the word, okay, you watch over, you surveil, and based on these informations, you can now make decisions, you can now take actions. Okay, so it's basically monitoring the pulse of the community. What's happening in the community? Nagkakasakit ba yung community? Okay, for example, ngayon in daycare centers or in elementary schools, nagkakasakit yung mga bata. Now, that's surveillance, di ba? What are we going to do about this? So, yung iba nag-declare ng 2 weeks health break. So, online muna sila. Wala muna face-to-face, di ba? So, based on those data, you can now make wise health decisions. Okay, so you provide information for action. That is your public health surveillance. So this is a law of reporting of communicable diseases, an act providing for the prevention and suppression of dangerous communicable diseases. This requires all individuals and health facilities to report notifiable diseases to local and national health or authorities. So what is this? Is it A, B, C, or D? Okay, this is letter A, your RA 3537. Don't worry guys if you haven't memorized these. No, meron namang list sa mga hospitals ninyo, and the nurses, they usually remind you, Dok, kailangan nyo pong ano yan, i-report. And sometimes even yung guard, no? Yung mga kuya guard sa hospitals, talagang alam nila yung mga notifiable diseases na yan. And you as doctors, kailangan alam nyo din yung mga notifiable disease na yan. Kasi kayo talaga yung magre-report. Tayo talaga yung nagre-report. It's not the nurses, it's not the kuya guards, it's us. Okay? So, public health surveillance of communicable diseases and, of course, your non-communicable diseases. So, it starts with public and healthcare providers like clinicians, laboratories, hospitals. Tapos, gagawa sila ng report, submit sa Department of Health, and then the Department of Health will give us feedback. Oy, parang dumadami yung, let's say, HIV/AIDS sa ganitong region. Why? Okay, what are we going to do about it? So, or parang dumadami yung cases of hepatitis dito sa hospital na to. Bakit kaya? So, they will conduct mga investigations after yung surveillance. Prioritize health problems for surveillance include which of the following? So, is it A, B, C, D, or E? So, the correct answer here is letter E, all of the above. Okay? So, incidence of the problem, resources needed to conduct surveillance, effectiveness of measures for controlling the disease under surveillance, and the presence of characteristics of well-conducted surveillance. Okay? Another question, when analyzing surveillance data by age, which of the following age group is preferred? It, letter dog, depends on the disease, okay? Siyempre, kung anong disease prevalent, yung certain, dun ka mag-observe na age group, diba? Okay, I will give you time to answer this. Please match the following sentences if it's timeliness, representation, sensitivity, and specificity. Okay, so number 1, to provide an accurate picture of the temporal trend of the disease. So what is this? This is your letter B, representation. To implement effective control measures, rapid availability of data for public health authorities to take action. This is your letter A, timeliness. Diba? Rapid availability ng data. To allow identification of individual persons with disease, to facilitate treatment, quarantine, or other appropriate control measures. This is with disease. This is your sensitivity. And to exclude persons not having the disease, this is your specificity. Diba? Alam mo guys, dati nalilito ako sa sensitivity and specificity. But, iniisip ko lang na pag may sakit ka, di ba sensitive ka? Totoo yan, when you have, let's say, fever, gusto mo ikaw yung naasikaso ng mga tao. So, yun yung lagi ko yung isip, pag sensitive, may sakit. So, with disease. Diba? Parang ganon. Alright, next. These are your definition of terms. Acceptability is the willingness of individual persons and organizations to participate. Pag sinabi mong flexibility is the ability of the method used for surveillance to accommodate changes. So, mabilis silang mag-accommodate ng changes in operating conditions or information needs with little additional cost in time, personnel, and funds. So, very flexible sila. Let's say, mga 8 o'clock pa dadating si can we start at around 8:30? Ganyan. So, yung let's say, yung machinery, it will be delayed for 1 day. Okay lang ba yun? So, you have to change the schedule. So, are they willing to accommodate these changes? That is your flexibility. The quality reflects the completeness and validity of data used for surveillance. So completeness and validity is quality. The simplicity is the ease of operation of surveillance, stability, reliability of the method for obtaining and managing surveillance data, and the availability of those data. And of course, you have your validity, which measures what is intended to measure. So valid ba siya? Does it measure what is intended to measure? So kung may long exam ka, ito yung objectives mo, na may measure niya ba yon? So valid ba yung exam mo? Okay. Another question, an outbreak of disease should be reported to the local or state health department if A, B, C, D, or E. So the correct answer here is letter E, all of the above. So if your diagnosis mo is uncertain, if it's infectious, if it's serious, and if the outbreak involved at least 10 people, okay, you should report it to the local health department. So we go to your field investigation. So the first one, public health surveillance, now field investigation. So ito yung tinatawag nating first actions. The first one, you collected data through surveillance. Second one, magkakaroon ka na ng actions. You identify a source or vehicle of infection that can be controlled or eliminated. For example, STD case tracing. So contact tracing ka ngayon. Kaya lang medyo mahirap yun, di ba, without their consent. But still, you identify the cause, the modes of transmission, and the appropriate control and preventive measures. So, kung let's say, alam mo yung mode of transmission, then you educate the people on the mode of transmission, okay, the appropriate control, get tested if you feel like this, di ba? So, those are important things that you should do. This is also called shoe leather epidemiology, yung field investigation, because usually the surveyors, okay, they go out into the field. Dati, yung mga surveyors, naka leather shoes, diba? Very appropriate yung mga tao ng araw. So, they wore leather shoes, and then the pavements, mga bricks yan, diba? Tas bato-bato. So, nauupod yung leather ng shoes nila. So that's why it's called shoe leather epidemiology kasi nauupad yung leather ng shoes. Okay? So field investigation, yun nga. How do you investigate pala? Yun nga, you can go house to house. Dati, phone calls for clarification, but now you have the internet. So magpapa-survey ka na lang online, Google form, 'di ba? It's very easy to do your field investigation nowadays. Of course, everything has to be done with consent. So, criteria for field investigation. So, is it A, B, C, D, or E? Okay, so the answer here is all of the above. Control or prevention of health problem, opportunity to learn, research opportunity, public, political, or legal concerns, public health program considerations, and of course, training. So those are the criteria for your field investigation. So, ayan, yan yung mga criteria mo for your field investigation. What is the most important reason for field investigation? Bakit ka pumupunta house to house? Bakit ka nagso-survey? Bakit ka tumatawag for clarification? Because you want to learn, di ba? You want to know something. So, that is the most important reason for field investigation. You want to learn something about a certain situation. Okay. Ayan. So the third off, after surveillance, you have field investigation. The third is analytical studies. Favorite ng mga tao to, research, di ba? Okay. So this is employing more rigorous methods. For example, descriptive epidemiology or your analytical epidemiology. Under doon is your design, conduct, analysis, and your interpretation. Okay. So, yung mga design, ito yung mga study designs, case report, case series, correlational, prevalence. Itong conduct, ano yan, mga permits, clearances, mga ethical tracking ng records. Kasi syempre, kailangan ano ka pa din, in good conduct. Alright, and of course, analysis, ito yung mga tables, measurements, odds, risk ratio, okay, level of significance, and of course, yung interpretation, yung mga take-home messages, yung sound recommendations, ayan, after doing a thorough investigation. I will tackle more of this in the next slides. So next question, the basic goal of your epidemiologic research is it's a basic goal. It's to compare the groups that differ in terms of exposure or outcome. A study published in the Annals of Internal Medicine purported to show that a variety of symptoms were more common among subjects with a history of suboptimally treated Lyme disease than among controls who had no history of Lyme disease. The data were obtained largely by a survey of the participants, to which the following distortions is the study most likely subject to. So is it A, B, C, or D, or E? Okay. So the correct answer here is letter E, selection bias, recall bias, and of course, your random errors, diba? The hallmark feature of an analytical epidemiologic study is this is your use of an appropriate comparison group. So very important in using an appropriate comparison group. Okay, so this is your epidemiologic studies. So it's divided into your observational and your experimental studies. Now, I want you to remember na pag sinabing observational, wala kang gagawin. O, di ba? Mag-o-observe ka lang ng random ng event. Okay? Unlike your experimental studies, ikaw yung mag-a-assign. Okay, so pag experimental, you as the researcher, pwede kang magbigay ng meds, pwede mong tanggalan ng meds, placebo, ganyan. But pag observational, hahayaan mo lang siya. You will just follow them throughout the course of the disease, so that's the difference between your observational and your experimental. And of course, under observational, you have descriptive, ecological, and cross-sectional. Okay, these are all hypothesis generating. And you have your case control and your cohort, which is hypothesis generating, but you want to know the cause of the disease versus the distribution of the disease in the descriptive studies. Okay. The best, of course, in all these research is your RCT. Okay, mataas yung strength ng epidemiologic evidence sa RCT. So, pag nag-residency kayo and you want to do a research, best to do RCT kahit mahirap. Ma-impress talaga sa inyo yung mga consultant ninyo, diba? But of course, most of us, we just do, mga descriptive studies or cross-sectional, ganyan. But if you start in first year, pwede ka actually prospective cohort. So, ito, naka-table lang siya, but it's basically the same as this. Okay? If medyo visual person ka, gusto mo naka-table. So, observational versus experimental. Under observational, you have descriptive and your analytical. I want you to remember dito sa table na to, yung alternative name nila. Kasi sometimes, wala siya dun sa choices, but then again, it's there. For example, the answer is cross-sectional. Pero wala sa choices. Ang nandun pala sa choices is prevalent study. Tapos hindi mo alam na cross-sectional is also called prevalent study. Di mali ka na agad. Diba? So I want you to also memorize the alternative name of the study design. Okay? So, yeah. Best to know them. So, we use descriptive study if little is known about the event or the phenomenon. Okay, the purpose is to generate hypotheses. Remember that. Little is known. Pero pag marami ka nang alam, okay, and you just want to test the hypothesis, it's usually your analytical study. A study was done where patients with high levels of non-HDL cholesterols, mga more than 100, was measured and then followed for 5 years. The number of cardiovascular events and mortality was recorded. At the end of the study, what is the study type? What is the type of study? Okay, so followed siya for 5 years. What is the study design? This is your cohort, diba? So a cohort followed for 5 years. The association between low birth weight and maternal smoking during pregnancy can be studied by obtaining smoking histories from women at the time of the prenatal visit and then subsequently correlating birth weight and smoking histories. What type of study is this? So what type of study is this? This is your prospective cohort. Very good. So, follow-up cohort, or also called your prospective cohort, diba? The subjects here are your pregnant women. Very good. Obviously, diba? Subject, pregnant women. And they are categorized on the basis of your exposure and your lack of exposure. To what? Cigarette smoking. Diba? So, smoking during pregnancy or not smoking during pregnancy. And then they are followed up after a particular time to know what outcome. Ano yung outcome na hinahanap mo dito? Yung outcome na hinahanap mo dito is your low birth weight, diba? So your low birth weight. So that is your cohort. Meron kang population exposed to a certain risk factor, and then you follow it up over time. And you compare it with a group not exposed to the risk. Okay? The outcome is disease incidence in each group, and it can be prospective. It can determine incidence and causal relationship if there is a statistical association between your risk factor and the disease. So remember guys, pag meron sa question na followed over time, usually isipin nyo, cohort to. Okay, it differs from an experimental study because in a cohort, the investigator observes. Diba sinabi ko sa inyo, nag-observe lang tayo pag cohort rather than determine the participant's exposure status. So pag meron din dun sa choices na parang observational cohort, yun yung i-choose nyo. Pero pag let's say nakasulat doon na experimental cohort, mali yun guys. Okay? So, minsan nililito din kayo doon. So, you go for the observational cohort kasi a cohort is observational. Okay? All of the following are analytical studies except alin daw ang hindi analytical study? It is your case series. Alright? So, it's just taken from here. Okay, analytical studies, alin dyan, except your case series. Kasi ang case series mo is descriptive, diba? Analytical ay cross-sectional, case control, and cohort. Very important to know this by heart. A study in which children are randomly assigned to receive either a newly formulated vaccine or the currently available vaccine and are followed to monitor for side effects and effectiveness of each vaccine is an example of which type of study. So is it A, B, C, D, or E? So the correct answer here is experimental and clinical trial, diba? So, sabihin natin, bakit? New vaccines, other group receives placebo. So, this is experimental, diba? Kasi nag-assign ka kung placebo, kung type A vaccine ba or type B. So, meron kang experimental. Meron kang input as a, as a researcher. And then, meron ka ding clinical trial kasi pag bago siya, usually, let's say, bago yung vaccine, okay, you determine the safety and the effectiveness of that vaccine. Like, for example, yung COVID, di ba? Before naman ginawa yan, nagkaroon ng safety and effectiveness of the vaccine. So, for this question, it's experimental and clinical trial. Yan. Hindi siya observational kasi hindi ka naman nag-observe, di ba? May ginawa ka. And hindi rin siya cohort or hindi rin siya case control. Next question. A group of researchers would like to study the cause of a rare form of sarcoma. They have discovered a registry of this form of cancer and have large access to the largest database of patients, which unfortunately is only a few years old. They have funding for only 1 year from the NIH, and note that the budget will be tight. So which study design would you recommend? So this is a rare form of disease. The budget will be tight. So this is your case control, diba? This is used for rare forms of disease, yung case control. So, anong inferential statistics nga ang ginagamit natin for case control? This is your odds ratio. Very good. So, odds ratio is used for your case control. Next question. In a study of the cause of lung cancer, patients who had the disease were matched with controls by age, sex, place of residence, and social class. The frequency of cigarette smoking was then compared in the two groups. What type of study was this? Okay, this is your letter D, case control. Okay, so meron kang case, and then they were matched with controls. Ayan na diba? Case, yung may mga disease, lung cancer patients, and then matched with controls. Obviously, it's your case and your control. Bakit pala siya case control and bakit hindi siya cohort? Bakit? Kasi, bakit? Kasi nag-compare. 'Di ba? Tapos, sa cohort kasi, usually, meron ka ng outcome. Unlike sa case control mo, 'di ba? Exposure, yung gusto mo, yung main concern mo. Okay, British investigators conducted a study to compare MMR vaccine among 1,294 children with pervasive developmental disorder. Example, mga autism, Asperger's, and 4,469 children without such disorder. They found no association. Okay, this is an example of what type of study. So, wala daw association. This is your observational case control. Observational case control. Kasi nag-observe ka, okay, wala kang ginawa. And then, ano yung case mo? Yung may mga MMR vaccine, okay, na may disorder versus yung mga wala. So always remember guys, pag case control, it identifies a group of people with the disease o yung may mga cases. Diba? So pag may, kahit ang haba-haba pa niyang sentence na yan, ang una mong tanong sa sarili mo, may sakit ba siya or wala? Disease? Okay, may disease ba siya or wala? Case ba ito or hindi? Yun ang tatanong mo. Kahit ang haba-haba pa niyan, nung sakit na in-explain, kahit ang dami pa nila, 4,000, kasi usually fillers lang yung mga words na yun eh. Pero ang kailangan mong alamin, pag nagbigay ng question, okay, yung examiner, case ba to? Is it being compared with the control? Kasi pag may case, tapos kinompare sa control, it is case control. Very good. So a case control can be retrospective. It can assess many risk factors for the disease. It can help determine causal relationships. It is the weakest because outcome has already happened. Usually, di ba, meron ng outcome. And it cannot assess incidence and prevalence of the disease. But it is very useful for studying conditions with very low incidence or prevalence like your rare diseases. So kung meron ka mga rare diseases in the hospital na gusto mong gawa ng study, anong gagamitin mo? Usually, case control. Diba? Epidemiologic studies, meron tayong case report and case series. Ano yung difference niya? Pag sinabi mong case report, okay, usually, pag nasa internal medicine kayo, di ba? Tapos may interesting case na dumating, or let's say pedia, may interesting case na dumating, di ba? You report this to your groupmates or during the morning meetings. So this is your case report. It's a clinical characteristics or outcome from a single clinical subject or event. So it's interesting. It's an interesting case. That's why you report it. So that's your case report. N1 lang siya, isa lang. But if it's a case series, okay, it's a clinical characteristic or outcome from a group of clinical subject or event. So mas marami sa isa. Let's say surfers. Okay, the number of surfers na dumating na, let's say, nagkaroon ng paralysis is like this. Okay, so may patient ka na surfer, okay, that's your case report, and then na-realize mo, parang meron ako nabasang ganito. So nag-research ka, tapos nakita mo, ang dami palang surfers na may the same case as mine, and then you report it, that is now a case series. Alright, clinical characteristics of outcome from a group of clinical subjects. Okay, let's compare to your cross-sectional. Your cross-sectional, also called prevalent study, remember that guys, cross-sectional or prevalent study, it determines in each member of the population the presence, prevalence, or absence, and other variables at one point in time without regard to duration. So at one point in time, prevalent study. Sabi ko nga sa inyo dati, favorite ko talaga tong question na to. Kasi pag tinatanong to ng professor namin, in the paragraph, nandun yung word na at one point in time. So basta nakita ko yung at one point in time or any similar wordings, ay sasabihin ko cross-sectional na yan. Alam ko cross-section na yan, prevalent study na yan. Wala nang tanong-tanong, yun yung sagot. So pag may nakita kayong ganyan, okay, isang beses lang in-interview, isang beses lang nag-face-to-face, isang beses lang, whatever, just one point, isang beses lang tinawagan, tapos wala nang follow-up, that is your cross-sectional study. It assesses the association of risk factor and the disease, and of course, hindi mo ma-determine yung causality, kasi wala ka namang, diba, future or past. It's only at one point in time. Okay, so yan, cross. So cross, para ma-remember nyo na prevalent study. So this type of bias occurs when experts may preferentially admit and keep track cases over other less challenging cases. So mas gusto daw nila yung mas magandang cases. Ganyan. So this is your popularity bias, diba? Gusto nila yung challenging cases. When questioned, years after an illness, individuals who served as cases, okay, yung mga may sakit case, reported more severe subjective symptoms than did those who served as controls. So, mga walang sakit. This is probably an example of what? This is your A, B, C, D, or E. So, this is your recall bias, diba? So, pag may sakit ka, and then you were the case for that research, magkakaroon ka ng recall bias kasi, you know, oh, that one time na nagka-COVID ako, ito yung mga naramdaman ko, Doc, diba? So, recall bias. What sampling method is employed when households are selected at random and every person in each household is included in the sample? This is your cluster sampling. Very good. Okay, what steps are involved in drug reaching the consumers? I want you to do the correct sequence. So is it A, B, C, or D? Okay, so the correct answer here is letter A. So drug discovery muna, bago yung preclinical animal testing, bago yung clinical trial. So this is the process of your drug development. The first is discovery and development. So yun yung unang-una. Yan, the drug discovery. Okay. And then during the drug discovery, laboratory research aiming to discover and research a promising compound. So meron silang promising compound, they research about it. The next is your preclinical research. So bago pa dumating ng clinic. Pre-clinic na siya, diba? So, laboratory and animal testing of the compound to answer basic safety questions. So, it has to pass animal testing. And then you have the third one, which is your clinical research. Here you ascertain the safety and effectiveness of the compound. You test it on humans. So, yun yung clinical research mo. And of course, the fourth is your government review. So, the government thoroughly reviews and examines data related to the compound to decide on its approval. So, matagal yung government review, no? Mga 2 years yan. And of course, you have your post-marketing surveillance, safety monitoring. Just because the drug is out doesn't mean it's safe. Kasi sometimes there are long-term side effects na hindi nakikita. So drug safety is continuously monitored once it is available for use by the general public. So indefinite yung post-market safety monitoring and surveillance. So ang pinakamatagal dyan sa process of drug development is of course your clinical research. It usually takes 6 years or more, depending on sometimes the budget. Okay, pero usually it's hard to make the rules and regulations and safety procedures, mga protocols for this. So depende talaga. But usually it takes approximately 6 years. So we go to your statistical tests. Statistical tests. Your favorite and mine. What statistical test should be used in comparing the serum cholesterol levels of patients before and after intake of a new lipid-lowering drug? So this is your A, B, C, or D, paired t-test. So before and after, diba? The best test to use here is your paired t-test because it is comparing two groups, the before and the after measurement of your cholesterol. So it so kung makikita nyo dito, the numerical variable, t-test is under that. So you have two groups of data, the independent and the dependent, or your paired t-test. So pag independent, it's also called student's t-test. Pag dependent, okay, it's your paired t-test kasi dependent. They need another person, they need another test. Dependence, okay? So that is your t-test. Of course, when we talk about two groups, yun yung gagamitin mo t-test. But if there are more than 3 variables, okay, you use your ANOVA. So it is used for more than 3 groups. And your t-test, best to remember that it is used for a population of less than 30. So pag madami, okay, we usually use your z-test. But for our purposes, t-test muna tayo for less than 30. Okay, next question. You want to conduct a study on the degree of LDL lowering in mg per dl of 3 statins, atorvastatin, rosuvastatin, and your simvastatin. What statistical test will you use to analyze the result of this study on whether there is a significant difference in their LDL lowering capability? So is it your A, B, C, or D? So the correct answer here is letter C, ANOVAs. We discussed kanina, diba? If there are more than 3 groups, you use your ANOVA. You are conducting a study on 2 populations being treated for soft tissue infection, with one population being treated with vancomycin while the other treated with Clinda. So it's Vanco versus Clinda. You want to compare whether the history of prior trauma, traumatic or non-traumatic or unknown, of the patients on each group varies. What statistical test will you use? Okay? So nagkaroon ka ng Vanco versus Clinda, but you also want to compare the history. So this is your letter A, chi-square test. So your chi-square test, it's under your categorical, okay, categorical or proportions. It is usually it usually requires a large sample size, and siya yung ginagamit mo if you want to compare that. Okay, you want, next question. You want to conduct a study to see if the varying infusion rate of a certain vasopressor affects patients' blood pressure. You obtain different infusion rates of that vasopressor and the corresponding blood pressure of the patient at that time. What statistical test will you use to analyze these results? Analyze these results. This is your letter C, Pearson's correlational. Diba? So from this group, statistical tests used when comparing variables, you have your chi-square, okay, and you have your t-test versus your t-test, your ANOVA versus your correlational test. Same lang to kanina, naka-table format lang siya. Diba? So best to remember that Pearson's correlational coefficient is a statistical test that measures the statistical relationship or association between 2 continuous variables. Okay? So kung meron kang best way to measure a linear correlation, ito yon, Pearson's correlational coefficient. Okay? It ranges from -1 to +1. So pwedeng ang Pearson's correlational mo is -1 to 1. So for example, magbigay tayo ng example. Merong, let's say, an advertisement. An advertisement for this product, okay? And the sales. Okay, so yung advertisement cost versus the sales. Gusto mo siyang i-compare. Now, the answer was the Pearson's correlational coefficients was 0.6. Okay, 0.6. So, ano yung relationship nila? Noong advertisement versus yung sales. It is a positive relationship. Diba? So, if they have a positive relationship, meaning, nung nag-advertise sila, tumaas yung sales. What about, let's say, negative 0.5? Yun yung lumabas sa Pearson's correlational coefficient. Okay? So, bakit gano'n? Nag-advertise sila pero bumaba yung sales. This could be due to, let's say, advertisement na, let's say, pangit, may negative connotation, or something. Kasi di ba minsan may mga advertisements na ganyan na parang fail. Nung nag-advertise sila, mas maraming hindi bumili because, you know, it was racist or it didn't sit well with the audience. So, yun yung Pearson's correlational coefficient. So you want to compare. Versus your regression. So pag regression, you quantify that relationship and then you predict the trends. Okay, so sa Pearson's correlational, meron siyang range from -1 to 1. Next, which statistical test is used when given more than 2 paired groups of ordinal data? O, pag ordinal, ano yung gagamitin natin? It's your Friedman test. Diba? So the Friedman test is the non-parametric alternative to your one-way ANOVA. With repeated measures, it is used to test for differences between groups when the dependent variable measured is ordinal. Okay, so that's your Friedman. Versus, pag nominal naman, it's your ANOVA. Okay, so used to determine statistical significance between the means of 3 or more independent groups. Usually, nominal is your ANOVA. So these are your examples of your parametric versus your non-parametric tests. Okay, so ano ba ibig sabihin nun, Doc? Yung parametric, guys, it's normally distributed ang data mo. So kung meron kang data, normally distributed sila within the curve. Pag sinabi mo non-parametric, it's usually distribution-free. Ayan, ito pala, nandito pala. Parametric assumes distribution of the population being studied. While non-parametric, okay, distribution-free siya. So ito yung data setup, kung ilang variables ba siya, kung between ilang subjects. Okay, and these are your parametric tests, kung for example, independent t-test or paired t-test. Okay, and the non-parametric test na kasabayan niya if the data is distribution-free. Okay, so you still have to know this, guys. Okay, I know, sabihin ko sana, kailangan alam nyo to, but no, you have to know the whole table. Okay, next question. In a Bayesian statistics, which of the following distributions will allow you to make better predictions on the outcomes of future events, considering and combining background knowledge and new evidence? So is it A, B, C, or D? So the answer here is letter B, posterior distribution. So ano ba to? Ano ba to Bayesian statistics? So the Bayesian statistics is background knowledge about a parameter in a statistical model. So ano ba yung background knowledge na yun? This is your prior distribution. Okay? Tapos, magkakaroon ka ng observational data or the likelihood function na tinatawag, and then you have to determine the posterior distribution. Okay, so the posterior distribution is now what you use to make predictions of future events. Oh, paano yan? Oh, Doc, ang gulo, naguluhan ako. It's like this. So, for example, you usually buy from Shopee or Lazada. Diba? Nag-order ka online. And your experience, okay, sa Shopee or Lazada, all purchases mo were good naman. Let's say 5 out of 6 purchases were good. And your isang purchase lang, 1 out of 5 out of 5. So 5 out of 6 purchases were good, and 1 out of 6 was defective, but nagkaroon ka ng refund. Okay, so overall, you still had a good experience shopping in Shopee or Lazada. So what is the probability that your next Shopee or Lazada delivery will still be a good one? So this is what you use, your Bayesian statistics. So parang it's like predicting the future, but in a statistical way. Okay, so we don't just make predictions. Parang, ganyan yan, ganyan. No, we do it in a statistical way, diba? So that is your Bayesian statistics. So ito siya. Okay, so meron kang prior beliefs. Ayun yung parang all naman ng orders ko were good. And then, meron kang posterior beliefs. Okay, na kahit na hindi okay yung order mo, na-refund ka. And then, meron kang evidence nun. So that's your Bayesian analysis. So, question, in your paper, you want to illustrate the proportion of all the deaths that occur from 2010 to 2020, whether they are from cardiovascular-related, infectious, malignancy, accidents, or others. What graph will you use? So, what graph will you use? Is it A, B, C, or D? So, the correct answer here is letter C, your pie chart. Okay, so your pie chart. Types of graph, of course, we have the bar graph. Okay, it's to compare data between categorical, independent of each other. So, yan yung bar graph. Pie chart, breakdown or contribution of parts from a whole. So, percentages, usually, pagka may mga ganyan, pie chart yung ginagamit. If you want to see its proportion from the whole. You have your line graph if you want to check for changes or trends over a period of time. So pag mga time, ganyan, it's usually your line graph. For example, yan, COVID deaths from January 2020 to September 2022. So, ayan, another line graph. So, in summary, bar graphs to show numbers that are independent of each other, pie charts to show you how a whole is divided, line graphs show you how numbers have changed over time. And of course, your Cartesian graphs have numbers on both axes, which therefore allow you to show how changes in one thing affects another. Actually, walang picture ng Cartesian dito, but ayaw gumana ng pen. Okay. So, dahil ayaw gumana ng pen, research nyo na lang yung itsura ng Cartesian graph. It's X and Y, tapos may number both axes for the Cartesian graph. What is a sampling unit in epidemiologic studies and the identification of your causal factors? So is it A, B, C, or D? So causal factors, this is a group of individuals. Next question. Representative sample of residents were telephoned and asked how much they exercise each week and whether they currently have or have ever been diagnosed with heart disease. So tinawagan sila, do you have heart disease? How much do you exercise? Have you ever been diagnosed with heart disease? Tapos binaba na yung phone. So what type of study design is this? This is your... Okay, guys, this is your observational cross-sectional, diba? So they were just telephoned and asked. Next, occurrence of cancer was identified between April 1991 and July 2002 for 50,000 troops who served in the first Gulf War. It ended around April 1991 and 50,000 troops who served elsewhere during the same period. So what type of study design is this? This is your observational cohort. Diba? So nag-observe ka lang and then from between April 1991 and July 2002. Persons diagnosed with new onset Lyme disease were asked how often they walk through the woods, use insect repellents, wear short sleeves and pants, etc. Twice as many patients without Lyme disease from the same physician's practice were asked the same question, and the response in the two groups were then compared. So this is your A, B, C, or D. May E pa pala. A, B, C, D, E. This is observational case control. Very good. So nag-observe ka lang, wala ka namang ginawa. And then you have your case, okay, versus yung case mo, yung may mga diagnosed with new onset Lyme disease versus your control, yung mga walang Lyme disease. Subjects were children enrolled in a health maintenance organization. At 2 months, each child was randomly given one of two types of a new vaccine against rotavirus infection. Parents were called by a nurse 2 weeks later and asked whether their children had experienced any of a list of side effects. So is this A, B, C, D, or E? This is your experimental kasi randomly given, di ba? Naka-red na nga yung word. Meron kang contribution o inassign mo sila for a particular vaccine. Okay. Next question. I will let you read this. It's a pretty long case. So you can pause it or whatever. And then let's go to the next slide. So the phenomenon described in the case is A, B, C, D, or E. It's letter B. It is a disease outbreak. So what is the attack rate if it's a disease outbreak? It's letter E. Okay? Ayan, letter E, 11/17. So how did we compute for that? The number of new cases among the population during the period over the population at risk at the beginning of the period. So of the 17 who died, 11 became ill. An early priority in investigating the phenomenon would be letter A, B, C, D, or E. Letter B, define the case. Yan, very good. The best case definition for the guess disease would be, definition of the case, it's abdominal pain, vomiting, and diarrhea within 24 hours of the state luncheon. Suspecting that the disease is a result of a common source exposure involving contaminated food, the investigators attempt to determine which food is responsible. So the initial task is to letter A, B, C, D, or E. Correct answer is letter dog. Interview the symptomatic guest to find out what they ate. The investigators suspect that the salmon mousse is the source of the disease. To confirm or refute their suspicion, they should A, B, C, D, or E. So the correct answer here is letter E. Perform a case control study in which the case are the guests who became ill and the controls are those who did not. Diba? So the investigators are unable to identify a single food that was eaten by every symptomatic guest. What should they do? A, B, C, D, or E? The answer is implicate the food most eaten by those with the symptoms. Okay? Next up, we have evaluation. Do you still remember the three? Surveillance yung una, di ba? Public health surveillance. Yung pangalawa is your field investigation. We had your analytical studies. Now we go to evaluation, the fourth one. So the evaluation is a process of determining as systematically and objectively as possible the relevance, effectiveness, efficiency, and impact of activities with respect to its established goals. Okay? So effectiveness refers to the ability of the program to produce the intended or expected results in the field. Okay, effectiveness differs from efficacy, which is the ability to produce results under ideal conditions. So I always tell my students, no, for example, effectiveness. Did top-notch, okay, effective ba ang top-notch? Malalaman mo if effective ang top-notch if you pass the boards. Kasi yun yung intended result mo expected outcome mo. Effective ba ang top-notch? Now, paano siya magiging efficacy? Magiging efficacy siya siguro if, let's say, meron tayong a group of students, let's say 50 students from top-notch, tapos in-house boarding mo sila. Tapos dun sa in-house boarding, meron silang schedule, okay? And then wala silang cellphone, wala silang ibang distractions. They do this from this time to that time. Okay? Kasi ano siya ideal conditions. Okay? So that is your efficacy under ideal conditions. But most of the time, it's usually effectiveness lang. Effective ba in producing the desired result? Now, effectiveness is different from efficiency. Pag sinabi mong efficiency, this refers to the ability of the program to produce the intended result with a minimum expenditure of time and resources. So let's say, did we waste your time? Did we waste your resources? Okay? Naging efficient ba ang top-notch? Ayan, different siya. I always look to efficiency pag sa bangko. Okay? Bakit? Kasi ang tagal-tagal mo minsan talaga sa bangko, diba? I don't know, I really hate going to the bank kasi every time, kahit na preferred pa yan, minsan may line talaga. Diba? So, feeling ko na waste talaga yung time ko and, my resources. I think they could have done it in a more efficient way. So, yun talaga yung aking, efficiency. Okay, not wasting time and resources. So, yan. Very important tong mga to, yung evaluation methods na to. In, let's say, meron kang program, nag-create ka ng program, let's say, vaccination program. Okay, so after the vaccination program, i-evaluate mo yung program mo, diba? So, naging effective ba yung program mo? Naging efficient ba siya? Okay, so those are the questions you need to answer. Okay, next question. This ability, often measurable, to avoid wasting materials, energy, efforts, money, and time in doing something or in producing a well-desired result. So this is your kakadiscuss lang natin, efficiency, letter C. So let's go to number 5, your linkages. So pag sinabing linkages, field epidemiology is often said to be a team sport. So you do not act alone or in isolation, and you collaborate with other sectors like specialists in our healthcare. You maintain relationship with the staff and other agencies and institutions. Healthy relationships, collaborative relationships. Okay, not yung Jowa Earth relationships. And usually official memoranda of understanding, sharing of published or online information for public health audience and outside partners, and informal network that takes place at professional meetings. So yan yung mga linkages mo. Okay, it's a collaborative approach. Medicine is usually a collaborative approach. So the 6 is your policy development. Diba sabi ko, sometimes ini-include nila, sometimes hindi yung policy development. So epidemiology is the study of the distribution determinants of health-related states and events in specified population. And the application of this study is to control the health problem. So pag sinabi mong application, usually yan yung mga policy development. So qualified position to recommend appropriate interventions regarding disease control strategies, reportable disease regulations, and healthcare policies. So basically sinasabi lang yan na you can now create policies, you can create rules and regulations, you can create laws, no? Because tapos ka na dun sa surveillance, sa investigation, sa analytical studies, sa evaluation, tapos ka na dun sa mga yon. Now, after linkages, di ba, nakausap mo na sila, you can now develop a policy as a team. Okay, so that is your policy development. So yan yung 5 major tasks of epidemiology in public health. 1, 2, 3, 4, 5, including your policy development sometimes. So kindly match this if it's a public health surveillance, field investigation, A, B, C, D, E, or F. So I'll give you a few seconds to answer. Okay, so reviewing reports of test results for chlamydia trachomatis from public health clinics. This is letter A, public health surveillance, diba? So nagre-review ka lang naman ng records. Meeting with directors of family planning clinics and college health clinics to discuss chlamydia testing and reporting. So this is your linkages, diba? So nagmi-meeting ka with other health professionals. Developing guidelines, criteria about patients coming to the clinics. This is policy development, diba? Interviewing persons with chlamydia to identify their sex partners. Letter B, field investigation. Conducting an analysis of patient flow at public health clinic to determine waiting times for clinic patients. This is clinic time evaluation. Comparing persons with symptomatic versus asymptomatic chlamydia infection to identify predictors. This is analytic studies. Okay. So we go to, okay, primordial prevention, primary, secondary, and tertiary prevention. So this is just a review, no? Pag sinabi mong primordial prevention, okay, these are laws to help you, okay, keep track of normal social behavior. Consists of actions to minimize future hazards to health and hence inhibit the establishment factors known to increase the risk of the disease. Okay, so for example, outlawing alcohol, discouraging smoking, promoting regular physical activities. Okay, nung time natin, during COVID, merong curfew hours, and then they had specific people can also go shopping during these days lang, okay? Only a certain person can go outside. So those are some primordial preventions. Okay? Pag sinabi mong primary prevention, okay, ito na yung mga health education, general promotion, specific protection. Okay? It aims to reduce incidence of the disease. So, pag primary prevention, guys, wala ka pang sakit. Okay, always important to remember that. Wala ka pang sakit. Protection siya against a certain sakit. Pag sinabi mong secondary prevention, okay, these are the screening programs, early diagnosis and prompt treatment, and aims to reduce the impact of the disease or injury that has already occurred. So sa secondary prevention, guys, meron ka ng sakit. Okay, meron ka ng sakit na probably na-detect. Like for example, breast examination, okay, pap smear, PSA testing for men. And of course, you have your tertiary prevention. Okay, tertiary is to limit the disability that can still occur. And of course, for example, ito yung mga physical therapy, psychological rehab in cases of deformities, cardiac or stroke rehab programs, post-op chemotherapy, okay, mga rehabilitation programs. So what about, for example, early detection and treatment for hypertension? Which category will that fall? Primary, secondary, or tertiary? Early detection and treatment for hypertension, this is your secondary. Kasi may sakit siya, di ba? Gusto mo early mo siyang ma-detect. Vaccination against COVID-19 is an example of what type of prevention? A, B, C, D. It is your specific protection. Question, previous board exam question. The pregnant mother with syphilis is treated with penicillin. What is the level of prevention involved? Primary, secondary, tertiary, or both primary and tertiary? So the answer here, guys, is both primary and tertiary. I know, diba? So the explanation here is it primary for the mother or the baby? Diba? Kasi you have to consider the mother and the baby here. Diba? So primary prevention for the baby, and of course, tertiary prevention for the mother. Okay, so that's why it's both primary and tertiary prevention. So, pero let's say, okay, let's say walang both primary and tertiary. Which will you answer? So, what level of prevention? You will answer tertiary, diba? For the mother pa rin. Following the Manual of Procedures by the DOH in 2020, in the TB DOTS program, which of the following is incorrect? So, is it A, B, C, or D? So which is incorrect? Letter C. Upon diagnosis on the first visit, the patient is given a full anti-TB regimen good for 6 months for free. Guys, hindi binibigay ang anti-TB regimen ng 6 months na buo. Like, ito yung gamot, inumin mo na siya. No. That is why our program is called TB DOTS, diba? Because it is directly observed treatment short course. Kasi kailangan mo-observe ng health worker, BHW, nurse, or layperson. Okay, so ito siya. Treatment adherence mechanism with a choice mutually agreed upon between the patient and the provider. Yun yung TB DOTS. Kailangan mag-agree kayo. Paano mo iinumin to? Pupunta ka ba sa clinic every day? Or since nag-work ka, pupunta ka na lang once a week. And then, after once a week, bibigay ko yung supply mo good for 1 week. So, yun yung treatment adherence program nyo. Location, home, community, workplace, or health facility. Saan mo kukunin yung gamot, okay, or saan kita pwedeng i-follow up and makita. Treatment supporter, oriented family member, trained lay minister, or health worker. Very important na may support person sila and may magre-remind usually sa kanila. Okay, especially if very busy person, malilimutin, or basta kailangan meron. May support. Health worker initially provides 1 week supply to the treatment supporter. So 1 week lang ang binibigay, hindi full 6 months. Adjust later to monthly dispensing, pwede, okay? Kasi yung iba talagang workers, may oras lang talaga ng pagpasok, okay? Na hindi pwedeng umabsent. Very, very hard for them. Regularly communicates with the patient at least every 2 weeks. Okay, tatanong mo na inom mo ba? May side effects ba? So, other modes of treatment supervision can be video call. Okay? O, di ba ngayon, pwede na, oy, patingin nga habang iniinom mo yung gamot. Ayan. So, pwedeng regular call then or SMS-based. Okay? So, pwedeng mat-text lang sa'yo. Parang, ay, nainom ko na po yung gamot ko. Ganon. So, that is your directly observed treatment short course or TB DOTS. So these are the services offered. So daily consultation and follow-up checkup, diagnostic workups for presumptive TB. So treatment regimen provided for free to admitted TB patients, okay, and enrolled TB patients. Very important kasi akala no iba, basta TB patient, free na agad. No, kailangan i-enroll ka muna sa program. No? Kasi kailangan magawa mo tong TB DOTS. Kailangan matapos mo yung course. Otherwise, sayang, okay? Sayang talaga. Referral of TB patients to external facilities for registration and treatment. So, let's say hindi ka pala pwedeng pumunta sa barangay kasi sobrang layo. So, pwede mo naman sila i-refer sa clinic na malapit sa kanila. Counseling and health education to TB patients and treatment partners. Kasi kailangan i-explain mo din kung bakit sila uminom ng gamot. Hindi to vitamins, ha? Okay, very important na parang kasi akala nila umiinom lang sila ng vitamins for 6 months. So explain to them. Very important to remember to remove the stigma. Remove the stigma, talk about it. Okay, especially if you're a nurse, a doctor, technician, okay, remove the stigma. na may TB siya, nakakahawa siya, nakakadiri siya, ganyan. So, remove it. So, weekly monitoring and follow-up of enrolled TB patients on ongoing treatments and monthly monitoring and tracing of the defaulters. So, yung mga hindi napunta, hindi nag-iinom, kailangan talagang monitor. So these are your concepts of disease occurrence. Meron kang causation, yung mga infectious diseases mo, yung mga epidemiologic triad or triangle, where you have the agent, the host, and the environment. And of course, you have your component cause or your causal bias. This is for your non-infectious diseases or your Rothman causal bias. So explain ko. So for your infectious diseases, ito yung mga meron. So you have your agent, your host, and of course your environment, and any imbalance, okay, between these three, they usually cause a disease. Okay, so a variety of factors can cause this. For example, sa agent, pwedeng yung own health ng agent, the biological makeup of the patient, ganyan. Sa environment, pwedeng malinis, madumi ba yung environment? Is it hot? Is it cold? Okay, the geology, is it in a high particular area or low particular area? Diba? So, for that, biologic agents, factors such as insects that transmit agents, diba? So, factor din yun sa environment and yung mga socioeconomic impacts such as crowding, sanitation, availability of health services, kasama din yan sa environment, diba? So for your for your agent, yung infectious microorganisms mo, diba? It can be a pathogen, pathogen like a virus, bacterium, parasite, or other microbes. So always remember that the presence of that organism does not necessarily always mean na magkakasakit ka. Diba? Kailangan merong imbalance in the three that will cause an infection to occur. Okay? Next question. Tim has a severe heart attack at the age of 58. The near-death experience so scares him that he quits smoking. Tim's wife is also scared into quitting smoking even though she feels fine. Tim's son resolves to never start smoking, seeing what cigarette has done to his dad. The act of not smoking for Tim, Tim's wife, and Tim's son represents what? So this A, B, C, D, or E? The correct answer is letter E. Tertiary prevention, okay, for Tim. Secondary prevention for Tim's wife. And primary prevention for Tim's son. Okay? Before quitting smoking, Tim, his cigarettes, and his tobacco smoke represent it. So before quitting smoking, Tim is the host, diba? So his tobacco is the vehicle, and of course, his cigarette is the vehicle, and the agent is the tobacco smoke. Next question. Biologic spectrum of disease are also called your iceberg phenomenon. So ano ba to? So yung iceberg kasi, kung galing na kayo ng north or south pole, okay, merong floating tip. Ito yung nakikita ng physician. It's usually what the community sees. It's only 1/9 of the whole iceberg. So every health problem, yung pinaka nakikita na part, okay, yun yung floating tip. What the physician, what the community sees. The submerged portion, the hidden mass of the disease, it's like a presymptomatic and undiagnosed case. Ito yung mga carriers sa community. Yung waterline is the demarcation between apparent and inapparent disease. So apparent, nakikita mo yung disease. Inapparent, hindi mo masyado nakikita. And patients who are at the tip of the iceberg are more likely to have multiple health problems than others. So ito yung iceberg tip. Yan yung maraming death, no? Kasi yan lang yung nakikita mo sa mga clinical cases. Pero hindi mo nakikita yung mga asymptomatic or yung mga carriers. So very important din yan sa iceberg phenomenon. For example, sa COVID, 80% mild or asymptomatic. Diba? But what do we see? We see the severe cases. They are usually highlighted in the media. Diba? So, yeah. That's the iceberg phenomenon. So this usually happens when a new disease emerges. So the first case that are reported tend to be the most severe cases. But after continued investigation, it reveals that these cases are merely the tip of the iceberg. Many more cases that are generally less severe are hidden from view initially, just as the bulk of the iceberg lies below the water and is not seen. Active surveillance generally is initiated only after the threat of transmissible disease has been exposed, and case finding is an effort to detect occult disease in a clinical setting as part of your medical examination. So an example of iceberg phenomenon would be letter C, widely publicized fatalities caused by the emerging coronavirus 19. So, widely publicized fatalities associating with an emerging disease like mga hantavirus may be an example of iceberg phenomenon pa din, diba? So, kindly identify whether this is a necessary, sufficient, or component cause. Right, let's answer this. So, before we answer this, let me explain to you. So a necessary cause is a component that is needed in every pathway. Without it, the disease cannot occur. So look in front, guys. As you can see, this is the Rothman's causal pi. The Rothman causal pi. Now, for the Rothman causal pi, we have your sufficient cause 1, your sufficient cause 2, and your sufficient cause 3. Now, for sufficient cause 1, sufficient cause 2, and sufficient cause 3, what do they have alike? So, anong letter? So, as you can see, they all have the letter A. Diba? So, letter A is the necessary cause. Okay, this is a component that is needed in every pathway, and without it, the disease cannot occur. Now, let's go to sufficient cause. Sufficient cause is the whole pie. So this whole pie, pi 1, pi 2, and pi 3, that is your sufficient cause. All right? It's called the whole pizza pie. That's your sufficient cause. Disease may have more than one sufficient cause, with each sufficient cause being composed of several component causes that may or may not overlap. So, ang isang slice ng pizza pie is called a component cause. Okay, those are your individual factors. Anong individual factors are we talking about? We're talking about, host factors. For example, if you're exposed to measles, hindi naman necessarily magkakaroon ka agad ng measles. So you have your immune system to protect you, skin barriers, and other things that are innate to you. So those are the component causes. Okay? And pag pinagsama-sama ang mga component cause, this is your sufficient cause. All right, sufficient cause. And remember, unnecessary cause is a component that is needed in every pathway. It's needed in every sufficient cause. That is your necessary cause. Okay, so this is used for non-infectious diseases. All right, and after all the pieces of the pie fall into place, okay, or it's complete, sometimes the disease occurs, okay? So let's identify whether it's a necessary, sufficient, or component cause. The first one, hypertension or stroke. So this is your component cause. All right. How about Treponema pallidum or your syphilis? This is your, necessary cause. Type A personality and heart disease. This is letter C, component causes. And skin contact with a strong acid or burn. This is your sufficient cause. Right? So again, a necessary cause, a component that is needed in every pathway. Without it, the disease cannot occur. So that is your Treponema pallidum and your syphilis. A component cause, all right, is your individual factors, component cause. So that is your hypertension, stroke, type A personality disorder, and heart disease. Okay, so that's summary. Let's go to the natural history and spectrum of your disease. So this is the spectrum of your disease. It starts from the stage of susceptibility and ends with the stage of recovery, disability, or death. Now, for the stage of susceptibility, we have, of course, your primary prevention. All right, this is intended to reduce new occurrences. Pero ano bang tinatanong dito? Usually, ang tinatanong dito is yung in-between stages. For example, exposure. So exposure is between stage of susceptibility to stage of subclinical disease. Alright, and of course, sa stage ng subclinical disease, dito na yung secondary prevention mo. Now, dito din included yung incubation period sa stage of your subclinical disease. Dito rin nakikita yung pathologic changes, alright, sa subclinical disease. Now, the onset of symptom is in between, okay, your subclinical and your clinical disease. That is your stage of subclinical disease. And that is your onset of symptoms between subclinical and clinical. Alright, usually, diagnosis is during the clinical disease, yung apparent na talaga yung disease mo, because it's sometimes hard to diagnose if subclinical pa yung disease, diba? But there are already ongoing changes inside the body that is usually not seen by the lay person. If you're a physician, yes, mapapansin mo, ay, parang nag-iiba yung kulay niya, ganyan. But for the patient, not the lay person, not so much. They don't notice small pathological changes. Okay, so question, a person with COVID-19 may be asymptomatic, and this person with inapparent or undiagnosed infection may be able to transmit the virus to an unsuspecting individual. Now, this stage is usually called inapparent undiagnosed infection, stage of subclinical disease. What marks the transition from subclinical to clinical disease? Onset of symptom, letter C. Most diagnoses are made during this stage of clinical disease, letter C. The illness range, okay, the illness range is also called your letter A, spectrum of disease. So again, let's just review. You have your stage of your subclinical disease. In between the subclinical and clinical, you have your onset of symptoms. Okay, and dun sa clinical disease, stage of clinical disease, that is usually the best time, or most of the time, diagnosis is made. All of the following are non-modifiable risk factors for acquiring diseases or infection, except non-modifiable, guys. This is your except body weight. Guys, modify ang body weight. Alright, so yung mga non-modifiable, they're usually family history, age, sex, menopause, race, type A personality. Modifiable, syempre, you have your diet. Smoking, stress, birth weight, dyslipidemia, body weight, alcohol, sedentary lifestyle, and of course, migration. Next question. A 52-year-old, generally healthy female patient of yours has recently been diagnosed with breast cancer. She is presenting for pre-surgical evaluation for her breast biopsy. What is the risk category associated with this surgery? Okay, so anong risk category mo siya? If you were the physician, you would, letter B, low risk lang siya, diba? You are doing a preoperative clearance for a 60-year-old man undergoing an elective knee replacement. He has diabetes, hyperlipidemia, and a history of poor myocardial infarction 4 months ago. After his MI, he had triple bypass surgery. Since that time, he has done well and has been asymptomatic from a cardiac standpoint. Which of the following is true in this case? Is it A, B, C, D, or E? So the correct answer here is letter E. Surgery should be deferred. Bakit? Hello, elective knee surgery lang naman siya, diba? It's not a life-saving condition. It's not a life-saving surgery. Okay, it's elective, so you could defer it until the patient, has complete and full recovery. Kasi meron siyang history of MI 4 months ago and nag-bypass pa siya. So very high risk. So let's go to the PAPM model, or the Precaution Adoption Process model. So this PAPM model attempts to explain how a person comes to a decision to take action and how he or she can translate that decision into action. For example, ako, I want to make a decision in life, ganyan. I-apply ko daw tong PAPM model. Adoption of a new precaution or cessation of risky behavior requires deliberate steps unlikely to occur outside of conscious awareness. So if I want to adopt new precaution or stop a risky behavior, for example, cigarette smoking, I want to do that, pwede daw itong PAPM model. You can use this in patients, especially your patients in the community na nagsusmoke, no? You want them to stop, so you can adopt this model. Or for example, meron kayong patient na you feel needs a healthier lifestyle. So, i-adopt nyo din tong model na to. So, the PAPM applies mainly to these type of actions rather than to the gradual development of habitual patterns of behavior, such as exercise and diet, in which health considerations may play some role. However, the PAPM would apply to the initiation of new exercise program or a new diet. Okay, so if it's something new, pwede daw gamitin ang PAPM. So these are the proponents of the PAPM model. So there are qualitative differences among people and questions whether changes in the health behavior can be described by a single prediction equation. So the PAPM describes a set of categories. So meron kang stage 1 to your stage 7. All right. It defined in terms of psychological processes within individuals. So psychological within the individual. All stages are defined in terms of mental states rather than factors external to the patient. Okay, so person. So it's psychological, internal. Okay, such as current or past behaviors. So ayan yung stage 1, stage 2, 3, 4, 5, 6, and 7. Now let's give an example. No, so adopting the PAPM model, we go for example sa HPV vaccine if you want to get one or not. So stage 1, you're unaware of the issue. Okay, unaware ka na may HPV vaccine pala. So, wala kang pakialam. That's stage 1. Stage 2, you are unengaged of the issue. Aware ka, but hindi mo feel na kailangan mo yung HPV vaccine. Parang, meron palang HPV vaccine. Okay. Stage 3, okay, undecided about acting. Okay? Or you are decided about acting. So, sa stage 3, okay, dito yung nag-iisip ka about the HPV vaccine. So, tandaan nyo yan, guys, kasi very important yung stage 3. Because sa stage 3, okay, there are 2 pathways. Papunta sa stage 4, which you decide not to act and decide not to get the HPV vaccine. Kasi low yung perceived susceptibility and marami kang concerns about the vaccine. Or you go to stage 5 and you decide to act and you plan to get the HPV vaccine. So, pag tinanong, saan yung stage na nagde-decide, okay, that is your stage 3. And then stage 4, boom, nag-stop, wala ka nang gagawin. Stage 5, you plan, okay, you decide to act. And of course, stage 6 is another important stage, which is acting. So, stage 6, okay, yan yung mga actors, acting on the thought. Okay, so you get the first HPV vaccination. So, pag tinanong, one stage yung nag-act na tayo or we decide to pursue the thought, it's stage 6. Stage 3, yung nagde-decide, okay? Stage 7 is the maintenance. You finish the HPV vaccine series. Okay, so kailangan once you start something, you finish it, diba? Once you start studying for the boards, you finish it all the way to the end. So that is stage 7 maintenance. Nandun na kayo, diba? Okay, so this is a case. I'll give you a few minutes to read it, and then we'll answer the succeeding questions. Okay, let's go to the question. So the most likely explanation for the outbreak noted by the local health department is your A, B, C, or D. It's your antigenic drift. Antigenic drift. Next, while the pork industry lobbied aggressively against dubbing the novel H1N1 influenza virus swine flu, substantial evidence supported that this wholly new genetic variant of influenza developed from confined animal feeds operation associated with commercial pig farming. The novel H1N1 virus resulted from, so was it a genetic shift, antigenic shift, or antigenic drift? This is your antigenic shift. Bakit? Kasi the H1N1 virus represents a major genetic change from the predecessor influenza variant from which it evolved from. Okay, so let's differentiate the antigenic drift from your antigenic shift, all right? Okay, so the antigenic drift is most likely the cause of changes in the strain that allowed infection despite adequate vaccination. Okay, because there is partial immunity or mutation to a less virulent strain, also due to antigenic drift, which is less severe symptoms noted. So, tingnan nyo guys, yung nasa harap ninyo. So, this is a boat, diba? It's a bangka. So, what does a bangka do? It moves, diba? Right to left, left to right. So, it's drifting, diba? The bangka is drifting. Meron bang changes na nangyayari dun sa bangka? Meron daw. Ano na siya, nagbabago naman siya. It goes from right to left. Malaki ba yung nagbago sa bangka? Hindi naman, di ba? So that is your antigenic drift. There are changes, but okay, it is very small yung changes. So that is your antigenic drift. Okay, look in front again. So this is the mutation for your antigenic drift. Meron lang siyang small mutations. Now, these small mutations are slow and progressive. Okay, and they alter the immunologic response and susceptibility. So, konti lang ang changes pag drift. Isipin nyo yung bangka, it moves right to left. Konting changes, antigenic drift. So, if you have, let's say, previous vaccines, somehow protected. Hindi maraming nagkakasakit. Now, how about your antigenic shift? Okay, let's go to antigenic shift. Now, if you look at the drawing in front, okay, this antigenic shift is considered a new strain. All right, there is a sudden change in the molecular structure of a microorganism. Now, these new strains, these new novel strains, there is little or no acquired immunity to it. Okay, so these new novel strains will now cause your epidemics and your pandemics. Okay, that is due to antigenic shift. Alright? So, remember, pag konti lang ang changes, antigenic drift. Pag malaki na, nag-shift na siya, yung bangka mo, okay, nag-transform siya into something bigger. That is your new strain and antigenic shift. So, from your micro, okay, antigenic shift may cause pandemic potential. We are all aware of this. Okay, there is profound variation in your HA, hemagglutinin, or your neuraminidase. So, nagkakaroon ng resortment of your genomic material. This antigenic shift happens for influenza type A only. Bakit type A lang? Bakit hindi B? Diba? Because influenza A and B do not share the same antigen. New virus with novel antigenic profile, alam na natin yan. Influenza virus transmitted from aquatic birds from the center directly to your fowl and pigs who then transmit them to humans. So always remember, yung hemagglutinin, your HA and your neuraminidase, NA, these are proteins on the surface of your influenza A, they can mutate and cause antigenic shift, which can cause your pandemic potential. So, bakit hindi vaccine failure yung kanina? Because vaccine failure would result in influenza cases with a high case fatality rate. Okay? Seen previously with the strain. So, ano ba yung mga mataas yung case fatality rate? So, ano yung 100% case fatality rate? Pag nagkaroon ka nito, pag na-diagnose ka with this, siguradong mamamatay ka. 100% case fatality rate. This is your rabies, guys, diba? Once you've been diagnosed with rabies, there's no going back. 100% case fatality rate. What's the next sa rabies na mataas ang case fatality rate? This is your smallpox, diba? Smallpox, 95% ang case fatality rate niya. What's next? Ebola. Ebola, 90% ang case fatality rate niya. Okay, so pag mataas ang case fatality rate, let's say 100 people have been diagnosed with rabies, 100 people will die. So yan yung ibig sabihin ng case fatality rate. Let's go to herd immunity. So herd immunity refers to, is it A, B, C, D, or E? Okay, so the answer here is letter D, the prevention of disease transmission to susceptible individuals through acquired immunity in others. Attempts to eradicate a disease through widespread immunization programs may be associated with potential adverse effects. Which of the following adverse effects is correlated with the effectiveness of a vaccine? So, masyado daw effective ang iyong immunization program and yung vaccine mo. So, which is it? A, B, C, D, or E? So the correct answer here is letter B, the loss of your natural booster effect. As we all know, every now and then, nagkakaroon ng booster effect ang nature. Okay, dumadami yung may sakit. This is your natural booster effect. But if your vaccine, immunization, ganyan, is super effective, nawawala daw yung natural booster effect na yun. Herd immunity. What is herd immunity? It would decrease the rate of infection by decreasing the probability that a susceptible person would come into contact with an infected person. It would not affect the clinical presentation of those infected. So look in front, guys. So I'm pretty sure all of you have heard of herd immunity, diba? So it is the presence of enough immune response in a community interrupts transmission from an infectious agent. So if you look in front, yung mga may red, those are your transmitting cases. Okay, so the ones in red, yan yung mga may transmissible cases. The ones in blue, okay, these are your susceptible individuals. Okay, so the one in blue, these are your susceptible individuals, kung mapapansin nyo. Now, in order for the case to transmit to the susceptible individual, kailangan hindi siya dumaan sa immune individual. Otherwise, the chain of infection will just stop dun sa immune individual. So, hence, that is your herd immunity. It is providing indirect protection for unimmunized or susceptible people. Okay, so what is the importance of herd immunity now? Can everyone get vaccinated? Can everyone get vaccinated? No, not everyone can get vaccinated. Who cannot get vaccinated? So there are certain groups of people who cannot get vaccinated. For example, people with previous severe life-threatening allergic reactions. So I've had a few patients na may previous life-threatening reaction talaga na tipong na-hospitalize sila after vaccination. Pregnant women or nursing mothers sometimes cannot get vaccinated. But vaccination usually safe during the second and third trimester. Depends on the vaccine. People with weakened immune system, yung may mga HIV/AIDS, cancer, undergoing immunotherapy using steroids or undergoing chemotherapy. These patients usually cannot get vaccinated. Okay, so in 2017, 17,200 reported cases of measles in the Philippines. So nag-increase. Okay, from 2017 to 2018, nag-jump. 367% increase ang reported measles cases in the Philippines. So kung mapapansin nyo, mataas yan na spike. So anong ginawa ng Philippines? We rolled out the vaccination programs. Okay, so this is the importance of your herd immunity. If you look at the diagram in front of you, for letter A, there is absence of herd immunity. So for one infected in initial case, okay, the first disease generation, nagiging dalawa. And then second disease generation, nagiging apat. Third, nagiging 8. But in the presence of at least 50% herd immunity, the first case, okay, magiging 1 lang siya. Okay? And then after that, magiging second disease generation, 1 lang. And the third disease generation, 1 lang siya. So mababa yung R0 niya na tinatawag. Okay? Mababa yung R0. Ano ba yung R0? So this is the R0. Okay? It's parang yung transmissibility niya. So this is the estimated herd immunity threshold for vaccines na prevent diseases. For example, let's go to your diphtheria. Okay, so the diphtheria is transmissible via saliva. Yung R0 niya is 6 to 7. Okay, and the herd immunity threshold is 85%. So ano ibig sabihin nun? In a population, okay, you have to immunize 85% of the population in order to get the herd immunity. Anything less than that, wala ka masyadong herd immunity. So, ano ba dito yung pinaka mataas na kailangan mo? Kailangan is your pertussis, 92 to 94%. okay, to have herd immunity. The next one would be yung measles. Kaya tayo laging may, di ba, may mga measles and yan. So, vaccination really works. So, yeah. So, this is your R naught. Okay, and these are your transmissibility. Paano siya nata-transmit? So let's go to coronavirus. So coronavirus is a crown-like crown, kaya siya tinawag na corona. It has spikes on its surface. Meron siyang 4 na subgroups, alpha, beta, gamma, delta, and it was first identified in the mid-1960s. So there are 7 coronaviruses that can infect people. So common human coronavirus, as you can see, itong 4, 229E, NL63, OC43, and HKU1. So the other human coronaviruses that we're familiar with, yung MERS coronavirus, SARS coronavirus, and your SARS coronavirus 2, which was the novel coronavirus that caused the coronavirus disease in 2019. Now, I've been lecturing this, for quite a while. And I may say na before, when we talk about coronavirus, parang hindi siya pinapansin ng mga estudyante. Like, uy, naturo siya, but just in passing. But now, when you talk about it, boom, ayan, parang, ay, na-experience ko yan in my lifetime. Oh, yes, meron siyang 7, subgroups. Ganun pala siya. So, very relatable topic na siya. So, what is the causative organism that, change topic na tayo ulit. What is the causative organism that causes your cancroid? So is it A, B, C, or D? So it is letter B is your H. ducreyi, diba? So canker is a symptom of syphilis, while cancroid is a symptom of your STI. So this is the difference between your canker and your cancroid. Okay, very important to memorize, to know by heart. Canker is caused by your T. pallidum, while cancroid is caused by H. ducreyi. Incubation period ng canker is 3 weeks, cancroid 4 to 7 days. Alin ang painless? It is your canker. Okay, but it is oval and hard. Tapos meron kang lymphadenopathy, it's usually bilateral, non-tender, non-suppurative. Pag H. ducreyi naman siya, very painful. Okay? Soft siya and covered by a membrane. Lymphadenopathy is usually lateral, tender, and suppurative. So painful, tender, unilateral, suppurative, H. ducreyi, 4 to 7 days lang siya. Cancroid. Okay? So, very important to take note. Ano palang treatment mo for your cancroid? Treatment for your cancroid is 1 gram azithromycin or ceftriaxone 250 milligram intradermal injection, usually sa puwet. Okay? Single dose. Diba? Pag syphilis naman, anong binibigay natin? Of course, we give your penicillin, diba? So, benzathine penicillin, 2.5 MU, IM din siya, single dose, usually sa buttocks. So, alin dito ang canker? Alin dito ang cancroid? Yung nasa taas, that is your canker. Diba? Ayan yung iyong canker sa taas. And the image depicts a closed dorsal view of a patient's penis. Okay? Highlighting the presence of penile canker which occurred during the primary stage of the syphilitic condition. Okay? Tapos itong nasa baba is your cancroid. What COVID vaccine is recommended for children 6 months to 17 years? A, B, C, D, letter dog. All of the above. So these are recommended for children. So you can also add Johnson & Johnson, Janssen. What is the meaning of your SAGE? ABCD. So SAGE is Strategic Advisory Group of Experts on Immunization. So that is SAGE. What country is currently in warning alert level 3? Avoid non-essential travel by the CDC. This is your Valenzuela. Okay, so ano ba yung mga alert warning level? 1, 2, 3. So pag 3, avoid all non-essential travel to this destination kasi mataas yung outbreak. Okay, so alert level 1, green, just practice your normal precaution. Filipinos arriving in the Philippines no longer need to undergo facility-based quarantine if, is it letter A, B, C, D, or E? So which one is the correct answer? So the correct answer here is letter E, all of the above. Okay, all of the above. Filipinos need to declare their health status upon entry to the Philippines. In order to do so, they need to fill up your e-travel. Okay, fill up your e-travel. Okay, tetanus can be caused by a toxin of the bacteria Clostridium tetani, which is usually found in the soil and enters the body through breaks in the skin. This disease then can be considered as which of the following? So is it A, B, C, or D? Letter? The correct answer is letter B, infectious or your non-communicable. So infectious diseases, they are a disease caused by a microorganism and potentially transferable to new individuals. So tinatawag siyang communicable, which is transmitted from one source to another. Pag non-communicable naman, it's usually caused by a toxin, but it is not transferred from individual to individual, pero infectious pa din siya. Okay, so don't get me wrong. Pag sinabi mong infectious, pwedeng communicable or non-communicable. Pag sinabi mong contagious, okay, contagious, that is very communicable diseases capable of spreading rapidly from one person to another. Okay? So, under infectious, meron pa ring non-communicable, okay, but it is caused by a toxin. Factors affecting communicability, for example, site of lesion of infected host, size of the inoculum, chance accident, coming into contact with bacterial species or strain, survival capacity in immune subjects, ability to survive outside an animal body, ability to multiply and survive in intermediate host or vector, and of course, the size of the reservoir of your infection. So what is the community reaction to the diseases? So marami to. There is absence of disease. So walang case on record. For example, smallpox, it has already been eradicated. Sporadic occurrence of a few and unrelated cases. Endemic, constant occurrence in low frequency. So merong hyperendemic, mesoendemic, and hypoendemic na tinatawag sa endemic. So pag sinabi mong hyperendemic, okay, hyperendemic is an endemic disease that affects a high proportion of the population at risk. A high proportion of the population at risk. Pag sinabi mong mesoendemic, okay, from the word, is an endemic disease that affects a moderate proportion of the population at risk. A moderate proportion of the population at risk. Pag sinabi mong hypoendemic, from the word, it is an endemic disease that affects a small proportion of the population at risk. So small, moderate, and high. Diba? How about an epidemic? An epidemic occurs if a number of cases of the disease is in excess of normal occurrence or expectancy. Pag pandemic, it involves many countries. And of course, now we have your holoendemic. It's an epidemic wherein every individual is already infected, especially in the younger population. So I want you to answer this. I'll give you time to answer it. You can pause and then we'll discuss the answers after. Okay, so for number 1, 22 cases of legionellosis occurred within 3 weeks among residents of a particular neighborhood, usually 0 or 1 per year. This is your epidemic disease. Average annual incidence was 364 cases of pulmonary tuberculosis per 100,000 population in one area, compared with a national average of 134 cases per 100,000. This is letter C, hyperendemic disease. Over 20 million people worldwide died from influenza in 1918 to 1919. So this is letter D, pandemic. Single case of histoplasmosis was diagnosed in a community. Single case, sporadic lang siya. About 60 cases of gonorrhea are usually reported in this region per week, slightly less than the national average. This is letter B, endemic. Which term best describes the pattern of occurrence of the 3 diseases noted below in a single area? So first one, usually 40 to 50 cases per week. Last week, 48 yung cases. So this is endemic. Fewer than 10 cases per year. Isa lang yung case niya. This is sporadic. Usually no more than 2 to 4 cases per week. Last week, 13 yung cases niya. So this is outbreak. So again, review. Pag sinabi mong common source, a group is exposed to an infectious agent or toxin from the same source. So now, common source, pwedeng continuous or intermittent yung exposure mo. Okay, so ano bang ibig sabihin ng continuous? Ibig sabihin, for example, in your house, madumi yung tubig. Okay? So, dun ka umiinom ng water. Continuous yung exposure mo to the dirty water. But, for example, in your house, pumapasok ka every day. So, you spend your working hours, let's say 7 a.m. to 7 p.m. at your work. Tapos, meron kayong source of clean water doon. So, your exposure to the dirty water in your house is intermittent lang. Kasi meron kang source of, cleaner water. So, yun yung continuous and intermittent common source. Pag sinabing propagated, it's from one person to another. So, propagation. Not necessarily people, but diseases. Okay? So, pag sinabing mix, they have feature of both common source epidemics and propagated. So, pwedeng galing sa common source, okay, sa isang tao lang, or sa isang exposure area, or pwedeng person to person na pag sinabing mixed. So let's identify whether this is a point source, intermittent, or propagated. So you can pause the answer and then we'll answer it after. So 21 cases of shigellosis among children and workers at a daycare center over a period of 6 weeks. Walang external source identified. Incubation period for shigellosis is usually 1 to 3 days. This is letter C, propagated. Okay? 36 cases of giardiasis over 6 weeks, traced to occasional use of a supplementary reservoir. So, ang incubation period for giardiasis is 3 to 25 days or more, usually 7 to 10 days. This is your letter B, intermittent or continuous common source. 43 cases of norovirus infection over 2 days, traced to the ice machine on a cruise ship. This is point source, letter A. A propagated epidemic is usually the result of what type of exposure? Propagated, P, person to person, di ba? Pag propagated, not necessarily humayo kayo at magpakarami, but person-to-person transmission. So, in organizing data, alam nyo, hindi ko alam kung bakit kasali to, pero there was one sa board exam na kasamang organizing data. So, let's go. Compiling information in an organized manner. The method can be line list or line listing. Line listing organized like a spreadsheet with rows and columns, okay? So, as you know, one row is called record or observation and represents one person or case of disease. So, it is usually horizontal, kaya siya tinatawag na row your boat horizontal. Okay? So, that is called an observation. Okay? Okay, malito? Record or observation. Yun yung tawag sa row. Okay, so horizontal. Pag sinabi mong column, each column is called a variable naman. Variable and contains information about one characteristic of the individual, such as race, date of birth, age, sex, okay, etc. So that is your column. Yan, row, horizontal. So types of variables, you have your nominal, ordinal, interval, and ratio. Okay, best to know this by heart. So pag sinabi mong nominal, values are categories without numerical ranking, such as country of residence, alive or dead, ill or well, vaccinated or unvaccinated, eat or did not eat. Okay, a nominal variable with two mutually exclusive categories is sometimes called a dichotomous variable. Pag sinabi mong ordinal, it can be ranked but not necessarily evenly spaced. For example, your cancer staging, diba? Interval measured on a scale of equally spaced units but without a true 0 point. For example, your date of birth, and of course your ratio, an interval variable with a true 0. Okay, kaya yung 0 sa huli, O sa ratio, okay, with a true 0. Height and duration of illness are examples. Okay, so guys, remember that nominal and ordinal, yung first two, okay, they are used for qualitative variables, kaya sila categorical. Okay, so remember, nominal and ordinal are qualitative and categorical. Yung interval naman in ratio, it is usually used for quantitative, and it is for continuous variables. Okay, so identify whether the following are nominal, ordinal, interval, or ratio. So I will give you a few minutes to answer. You can pause and continue. Okay, let's answer. So for the date of diagnosis, this is letter C, interval. Town of residence, this is letter A, nominal. Age is ratio. Pag sex, sex is letter A, nominal pa rin siya. Highest alanine aminotransferase, this is letter dog. And lymphocyte count is letter dog ratio. Next question, a 62-year-old man is rushed to the emergency department by ambulance during an episode of chest pain. The initial evaluation is performed by a triage nurse who reports to the emergency department attending clinician that the patient's pain is probably angina and seems to be severe. This characterization of the pain as severe is, anong type? A, B, C, D, or E. Ang galing ng triage nurse mo, diba? This is letter E, qualitative. A qualitative assessment. What is the appropriate measure of your central tendency in qualitative data such as gender, religion, or nationality? This is letter C, your mode. All of the following are true in a negatively skewed distribution except, laging tinatanong, okay, do not make mistakes. This is letter B. The mean is greater than the median, greater than the mode. Except, guys, ha? So, true in a negatively skewed. Ito, pag sinabing negatively skewed, guys, left yung tail. Okay? So, always remember, okay, sa isang graph, pag pakanan, positive. Pag pakaliwa, negative. Diba? So, dahil pakaliwa negative, pag negatively skewed, okay, it's to the left. All right, so outlying values are small. Pagka negatively skewed, it is skewed to the left. And, yun. So the mean, tapos nandito yung median, and this is your mode, yung pinakamadami. Okay, so kahit i-drawing nyo lang siya, di ba? Pag din-drawing nyo siya, makikita nyo naman eh. Kasi ang mode yung pinakamarami, di ba, na observation. So makikita mo, saan ba mas marami yung observations? Dito sa banda dito, or dito sa left side. Diba? So, kung maiisip mo, mas marami yung mode dito sa gitna. Diba? So, pag dinrawing mo na siya, alam mo na agad na nandito yung mode. So, you start with the left, mean, median, mode. Ganun siya. Diba? So, you really don't have to memorize it. You just, draw it and you'll know it from the drawing as long as na alam mo siya. Okay? So let's go to your normal distributions. Your normal distribution is also called your Gaussian distribution. Gaussian, G-A-U-S-S-I-A-N, Gaussian distribution. So I want you to remember the 68, 95, 99.7% rule. Okay, so ano yan, Doc? So for this, we have a normally distributed graph. So dito, yung 68, so kung makikita nyo, so we have your -1, -2, -1, 0, 1, 2, and 3. So these are your standard deviations, diba? Now, from 0 to -1 and 0 to +1, 34.13 plus 34.13, that is your 68. So anything na nandito sa gitna, that is your 68. Now, from -2 to +2, that is now your 95. So 95% tong apat na to. 95%. Now, from your -3, okay, to your +3, that is now your 99.7. Okay, so that's your 99.7. We'll talk about that more later. I'll explain that later. But for now, I just want you to know that. Okay, so dito, yung mean mo, nasa gitna. Yung median mo, nasa gitna. Yung mode mo, nasa gitna pa rin because it is normally distributed. Okay, so let's compute. In 9 families surveyed, the number of children per family were 4, 6, 2, 2, 4, 3, 2, 1, and 7. So can you please compute for the following? The mean, the median, and the mode. Okay, so you can pause this and I'll give you the answer. So these are your measures of central tendency. So the mean is the average, the sum of the observations divided by the number of observations. The median is the middle observation in a series of ordered observation, for example, 50th percentile. And the mode, yung pinakamarami, diba? The observation that occurs with greatest frequency. So yung kanina natin, the mean is 3.4. Okay, so how did you get that? You added everything and divided by 9. So 31 divided by 9, the answer is 3.4. The median, yung gitna. So pag median, guys, kailangan you arrange it from smallest to highest. Again, you arrange it from smallest to highest. You pick the middle number, that is number 3. Okay? Yung mode naman, yung pinakamarami. So, as you can see, 2 yung pinakamarami. Now, what if the median is an even number? Kasi pag even number, di ba? Walang nasa gitna. So what do? You add the two variables na magkatabi and you divide it by 2. So let's see. Dito, can you compute for the mean, the median, and the mode? So the mean here is, you added 29 divided by 6. That's 4.83. Very good. So what's the median? Yung nasa gitna. Okay, but it is an even number. Diba? So what you do is you add 3 plus 5 divided by 2. So the median number is 4. Okay? So yung mode mo, yung pinakamarami, it is 3. Diba? So that's how you compute. Pag range naman, if it's arranged from lowest to highest, you just subtract. So the highest number subtracted by the lowest, that is your range. So can you kindly compute for this? Okay, so the scores of an IQ test were normally distributed approximately with a mean of 100 and a standard deviation of 15. Use the 68, 95, 99.7 rule to answer the following. So about what percent of the population have IQ scores above 100, above 145, and below 85? So I'll give you a minute to solve this. You can pause it. Okay, so let's solve. Okay, so right here, we have your normally distributed curve. Now, ang sabi dun sa kanina, the mean is 100. Okay, so kung the mean is in the middle, diba? So the mean is equal to the median, equal to the mode, it's 100. Okay, now, if 100 siya, kanina, the question was, the mean of 100 and there was a standard deviation of 15. A mean of 100. Pag sinabi mong standard deviation, guys, it is yung nandito sa baba, diba? So, kanina, this was 0, negative 1, negative 2, negative 3. But for our purposes, since ang mean is 100, ang standard deviation ay 15. So, itong 100 plus 15 will become 115, plus 15 will become 130, plus 15 will become 145. So, the same for the left side. 1, 2, 3. Okay, so 100 take away 15 will be 85. This will become 70. This will become 55. Okay, so that is your Gaussian distribution. Now, we can solve for the question, diba? About what percent of the population have IQ scores above 100? So, ang tanong niya is above 100. So, anong percentage to, guys? Okay, so if this is above 100, that is 50%. Because you have to remember, everything above is 50 and everything below is 50. Okay? So, ang tanong is letter A, above 100. The answer is 50%. Now, the next question, letter B, is above 145. Now, if we want to get this above 145, from yung rule natin kanina, which was 68, 95, and 99.7, okay, which one are we gonna use? The 68, the 95, or the 99.7? So, we're going to use the 99.7 rule. Diba? So, if you wanted to get above 145, okay, above this, we just have to subtract. So, it's 100, take away 99.7, that's going to be 0.3, correct? Now, itong 0.3 na yan, this is for both sides, the right and the left. We only want to talk about the right side. Yun lang yung tinatanong. So, we divide this by 2. Okay, and when we divide it by 2, what will become the answer, guys? So, the answer here will become 0.15%. Diba? So, that's letter B. Okay? So, the next question is letter C, below 85. Okay, so for below 85, what are we gonna use now? Kasi ito yung tinatanong nila eh. 85, below 85. So what are we gonna use? Are we gonna use the 68, 95, or the 99.7 rule? So for that, okay, we're going to use the 68%. Okay, the 68%. So anong gagawin natin sa 68%? So, 100, take away 68%, okay? It will become, sorry, mahina ako sa math. 32. Tama, diba? 32. But then, if we use that 32, that is the right and the left side. And gusto lang naman natin is just one side, diba? So, we then divide it by 2, and the answer will be 16%. So, the answer for the first one is 50, the second one is 15%, and the third one is 16%. Okay? Okay, now we go to standard deviation. A standard deviation is the average distance of each score from the mean, or how much each data value deviates from the mean. So, kanina nga, di ba, yung standard deviation natin was 100. Okay, so yung mean natin was 100. Yung standard deviation pala natin was 15. So, nag-add lang tayo. Now, if we have a small standard deviation, let's say of 15, if we plot it, so sa tingin mo ba, small yon or large yung standard deviation? That's small, diba? So your graph will be peaked like this if you have small standard deviations. Now, if you have a large standard deviation, let's say yung standard deviation mo, let's say was like 300 or like 200, ganyan. So you will have a large standard deviation, okay, and magiging low yung peak ng iyong curve, ng iyong bell curve, all right? So the characteristics of your bell curve, it is symmetrical. The mean is always equal to the median, always equal to the mode. Everything to the right is 50%. Everything to the left is 50%. So pag binigyan ka ng, let's say, mean of, let's say, 200. Okay, everything to the right ng 200 is 50%. So ano yung 50% sa left? It's 200. Diba? So, ganun yung thinking mo if binigay sa'yo mean, yung median, and the mode if it's normally distributed. The total area under the curve and above the x-axis is equal to 1. Okay, so it's equal to 1. Kaya kanina, diba, ginawa ko siyang 100 subtracted by the number. So again, the long tapering tails never touch the x-axis. It is determined by its parameter. So this is the mean and this is the standard deviation. The standard deviation becomes a more meaningful quality than merely being a measure of dispersion. So yan siya. Okay, next, let's go to your GDPs, GNPs, yung mga ganyan. So what is a good indicator of the size of an economy? Is it A, B, C, or D? So the correct answer here is letter A, GDP. Okay, so GDP. Ano ba ibig sabihin ng GDP or your gross domestic product? I know we've touched this, but let me explain. It's a monetary value of all goods and services produced within a country's geographical boundary during a given period. It is an indicator of the size of the economy. So pag rising ang GDP, this is a sign of an expanding market and encourages companies to invest more in the country kasi tumataas yung gross domestic product. Okay, it is only produced in the geographic boundary of the Philippines. Okay, so there are two methods to calculate your GDP, your expenditure approach and your income approach. Now, I won't say that you have to memorize this, but at least alam mo lang siya. So the GDP for the expenditure approach, malamang expenditure, so it's your consumption plus government spending plus investment plus net exports. Okay? And pag sinabi mo namang income approach, it's the income earned, so total national income plus sales tax plus depreciation plus net foreign factor income. So, yun yung two ways. Basta ang alam nyo, two ways, expenditure approach and income approach. Okay? So GDP versus GNP. So the most preferred way of calculating the national income involves two concepts. Okay, it's the GDP and the GNP. That's how you calculate the national income. So the GDP, as we discussed, is the domestic product. The size of the economy of a nation represents the total amount of goods and services produced inside your country for a one fiscal year or financial year. Okay, so the GNP naman, gross national product, represents the total value of goods and services produced by residents. Okay, national. Yung nationality mo as a Filipino. Okay, so kung ikaw ay Filipino working abroad, part ka ng gross national product. Okay, kasi ang nationality mo ay Filipino pa rin. Of a country during a financial year, income earned by citizens of the country present within or outside the country and excludes foreign nationals. So yung mga income ng foreign nationals here in the Philippines, hindi siya counted sa gross national product. Purely Filipino lang ang national product. So gross national product. So the gross investment versus your net investment. So GI and NI yung tatawag natin sa kanya. So GI is a total expenditure that is made for buying capital goods over a time period without accounting for depreciation. The amount the company invested in a particular asset without depreciation. Okay, so remember that, without depreciation. NI is the actual addition that is made to the capital stock in a given period, takes into account depreciation. So pag NI may depreciation, as is calculated by subtracting the depreciation from the gross national investment. So GI, meron depreciation. NI, okay, ay sorry, GI wala. NI, merong depreciation. So let's apply this. So which is considered a GDP or your GNP? So answer this on your own. You can pause it and then we'll answer it together. Okay, so it only measures the domestic product. Very obvious, di ba? Nandun sa word, domestic. So it's your GDP. It only measures the national product. This is your GNP. Very good. The strength of the country's economy. This is your GDP. Production that is made by citizens living in different nations. This is your GNP. Local scale, GDP. International scale, GNP. The goods and services that are being reproduced outside the country are excluded. Excluded, this is your GDP. The goods and services that are produced by foreigners living in the country are excluded. This is your GNP. So can you tell me if this is GI or NI? Total expenditure done for buying capital goods or adding the capital stock over time period without counting depreciation. This is your GI. The actual expenditure done for addition to the capital stock or buying capital goods over a time period taking into consideration depreciation. This is NI. It gives an idea about how much money is spent totally on capital goods. GI. It gives an idea about how much money is actually spent on capital goods by taking into account factors like wear and tear, helps in improving efficiency of the organization. This is your NI. So question, which of the following is a good index of severity for short-term acute diseases? These are your letter C, case fatality. Which is the core and center of all reforms under the universal health care? Oh, center of all reforms. This is your letter A, primary care. So ano ba itong universal health care na to? So this is your RA 1122.3. That's what I like to call it. 11.123, parang ganun. So on February 2019, President Rodrigo Duterte signed the Universal Healthcare Bill into law, ushering in a massive reform in the Philippine health sector. Among the salient features of this UHC law are the expansion of the population. So madami siyang dinagdag, the service and financial coverage through an array of health system amendments. Along with this is a planned paradigm shift, of course, to primary care, which is the core and center of all health reforms under the UHC law. So primary health care. So question, under the UHC, who among the following will need to pay a premium or direct contribution? So is it A, B, C, or D? So the answer here is letter dog, dependents of your migrant workers. All of the following are indirect contributors of your PhilHealth, except, sino ang hindi indirect contributor? This is your letter dog, household helpers. Okay, so under the UHC Act, ito yung mga direct contributors. Yung may mga capacity to pay the premium like you and me. So employees, self-earning professional practitioners, migrant workers, including their qualified dependents and lifetime members. So others not mentioned above are considered as indirect contributors. They include indigent individuals by the DSWD, beneficiary of the conditional cash transfer programs, and those identified in special groups such as senior citizens, persons with disabilities, and Sangguniang Kabataan Officer. Their monthly payment in PhilHealth are covered by the national government. Okay. Next, the following are parts of the 4S program of the DOH against mosquitoes, except letter So except letter A, safety and security of children outdoors and indoors. So ano yung S? It's your search and destroy, yung unang-una. The second is self-protection. The third is seek early consultation for fever lasting more than 2 days. And of course, say yes to fogging when there is an impeding outbreak. Actually, hindi nga ako pabor dun sa fogging na yan kasi feeling ko you just blow away off the mosquitoes and then they transfer to a different location. You have to find the source, preferably yung water kung saan sila nagre-reside. No? So, yeah. The cage questionnaire asks the following questions except, is it A, B, C, or D? Ano ba yung cage questionnaire na to? Except letter A. Have you ever felt you needed to cheat? So ano yung C doon? The C in the cage questionnaire is, have you ever felt you needed to cut down on your drinking? Okay. The A is, have people annoyed you by criticizing your drinking? So pag tinanong ka, okay na parang, uy, pare, inom ka naman ng inom, ganyan. Baka naman, ganyan. Okay, have you ever felt guilty about drinking? Shit, inom na ako ng inom, ganyan. Nag-guilty ka na? Have you ever felt you needed a drink first in the morning, eye-opener, to steady your nerves or to get rid of a hangover? So parang pagising mo, parang kailangan ko lang mag-shot ng isa. Okay, so if you answer yes to 2 questions, okay, 2 yes responses indicate the possibility of alcoholism should be further investigated. So, 4 na questions lang yan. Cut down, annoyed, guilt, and eye-opener. So, kung merong dalawa dyan, possible lang naman yung alcoholism, okay? So, this cage questionnaire is considered a validated screening technique with high levels of sensitivity and specificity. So, kung meron kayong kapitbahay, okay na, alam mo yan, yung feeling mo makaka-answer nito, you help them explore. All right. Let's go to your definition of terms. Optimism means hopefulness and confidence about the future or the successful outcome of something. You are optimistic. Wellness is a state of being in good health, and of course, healthy lifestyle is one which helps to keep and improve people's health and well-being. So bakit tayo may mga definition of terms? Kasi minsan, lumalabas po yun sa board exam. Next question. Public health policies for the prevention and control of schistosomiasis include all of the following except. Is it A, B, C, or D? Except letter. Nag-isip sila. So it's except letter A, except letter B, adequate treatment of individuals with praziquantel. Kasi treatment na yan, guys. It's no longer a prevention. An intermediate host is a host in which the agent undergoes letter B, an asexual phase of its development. Okay? Intermediate host yan. Pag yung mga definitive host, guys, it's usually a vertebrate, while intermediate host can either be a vertebrate or an invertebrate. Yan. Okay, so let's answer this. Can you compute for the sensitivity, specificity, and the positive predictive value? I'll give you a minute to answer. Okay, so for your sensitivity, it's 90 over 190%. For your specificity, it's 840 over 900 or 93%. And your positive predictive value is 90 over 150 or 60%. All right, a researcher develops a new novel assay for the diagnosis of your typhoid fever. He then tests it compared to bone marrow culture. There were a total of 400 patients. A total of 250 was found to have typhoid. Of this, only 130 patients tested positive in the new diagnostic test. The new diagnostic test was also found to be positive in 5 of the patients without typhoid. What is the sensitivity of the test? So kindly do the magic table and then compute. So fill this up. Okay, so I will show you the answer. Hopefully, parehas tayo na answer. All right, so that is your answer. So the answer here for patients without typhoid, what is the sensitivity of the test? This is letter B, 52%. So that's 130 divided by 250. Okay, that's 0.52. Multiply it by 100, you get 52%. Next. What is the specificity of the test? So the specificity of the test here is letter dog, 96.67. So that's 145 divided by 150 multiplied by 100. You get 96.67%. Okay, so you have a case here. You have a new test kit. Kit yan. You wish to evaluate. You have sample validated specimens that you know for sure whether from healthy or diseased individual. Your sample panel consists of 150 positives and 400 negative cases. What is the test sensitivity, specificity, positive predictive value? What is the negative predictive value? So yan yung apat na tanong. After running the samples through an assay, you compare the results to their known disease status. So ito yung results nila. Okay? Now, after the results, gumawa sila ng magic table. Okay? So ito yung genuinely positive is 144. Diba? So, genuinely negative is for the test positive is 12, the test negative 388. So on total niya is 400. Alright, so sa genuinely positive, ang nag-test ng positive is 144, test negative is 6, and the column total is 150. Ayan, so 144 and 388 here. Now, compute daw for the sensitivity, specificity, and positive predictive value and your negative predictive value. So hopefully, guys, you have the same answer. Okay? So if not, review pa tayong konti. Alright, so ito is how we got it. So, pag sinabing sensitivity, I always like to say, pag sensitive ka, may sakit ka. Diba? So, if you're feeling bad, you're always sensitive, and hence, true positive siya over all the people with the disease. Lagi ko in-associate yun. Pag kamasama pakiramdam ko, very sensitive talaga ako. So, that is your positive in disease. Okay, positive in disease. Note that positive in disease or your PID is a sensitive topic, di ba? And remember the mnemonic snout. Ano ba to? Sensitivity, okay, SN, okay, rules out. Kaya siya negative results. High sensitivity, if it's negative, you can rule out. Kaya siya snout. Okay? So, high sensitivity is desirable for a screening test to rule out. So, that is your snout. For your specificity naman, this is your true negatives over all the people without the disease. So, mga walang sakit, negative in health. So, remember the mnemonic spin. Okay, so specificity, pag positive, it rules in. So, pag mataas ang specificity ng desirable test, mga confirmatory test, you can now rule in. So again, a review. Sensitivity is the ability to label, okay? Positive, all those na may sakit. Specificity, ability of the test to label negative, all those na walang sakit. Okay, remember, your screening test is sensitivity, rules out, and your confirmatory test is specificity, rules in. Okay, so ayan. Isipin nyo na lang like, mangingisda. Okay? Pagka sensitive siya, okay, you have to get all the positives. Okay? Yun yung sensitivity. So, lahat ng positives, kailangan makuha mo. Okay? Pag nangisda ka, lahat ng positives makuha mo. Now, versus, let's say, a sniper. Ang sniper kasi, kailangan very specific yan. Diba? Naisip mo ba, kung hindi specific ang sniper, ano na lang mangyayari sa world, diba? So, pag specific, you can tell the negatives from the positives kasi ganun ka na lang kagaling. Okay? So, that is your specificity. Versus sensitivity, para kang mangisda, kinuha mo lang lahat ng positives. Okay, so this is the truth table that I always like to remind my students about. Okay, so you just make it, okay? So, pag sa test, you make it. So, lagay mo positive, negative, positive, negative. Okay, and then after doing that, you put A, B, C, and D. Okay, it has to be in that order, ha? Left to right, left to right. A, B, C, D. Okay, and then you can put this through positives. You can put false positives and you can put false negatives and true negatives. Or pwedeng A, B, C, D lang. Depende talaga sa inyo. Okay, so now what do we do? Oh, hindi pa pala siya doon. So now what do we do? Ayan. Okay, so if we want to compute for your sensitivity, it's just going down. Okay, so put a line going down. It's A over A plus C. So, nag-memorize ba kayo? Hindi. Naglagay lang kayo ng arrow going down. So, sensitivity, pababa. Pag specificity, okay, pataas. Paano mo siya gagawin? D over D plus B. Okay? So, ganun lang siya. Specificity. Sensitivity, pababa. Specificity, pataas. Tok, ganun lang pa yun. Tok, nag-memorize. Hindi na. So, ano pa? Ano pang amazing sa table na to? Positive predictive value. Pakana naman siya. So, it's A, okay, over A plus B. Diba? Or, true positives over true positives plus false positives. Ang galing, diba? So, pag positive predictive value, pakanan. Now, what else? Pag negative predictive value naman, it's pakaliwa. So true negatives over true negatives plus false negatives. That is your negative predictive value. So nag-compute pa kayo? Hindi. Diba? Memorize pa kayo? A little. Down, up, right, left. Diba? So yun lang yung tinandaan mo. It's easier than memorizing the formula. But if you want to memorize the formula, that's okay too. All right. So let's go to the next question. What is the positive predictive value now? So I'll give you a minute to answer. So nag-unmute ako kasi minsan inuubo ko. Ayan, so what is the positive predictive value? It's letter dog, 96.3%. Okay, next. So what is the negative predictive value naman dito? So the negative predictive value is letter boy, 54.72%. So how did you compute for that? 145 divided by your 265. Okay, so this is your positive predictive value, again, through positives over positive test results. So it is the probability of having a condition given a positive test. Negative predictive value through negatives over negative test results is the probability of not having a condition given a negative test. Now, unlike sensitivity and specificity, predictive values are dependent on the prevalence of the disease. Okay, so yung predictive values dependent siya sa prevalence of the disease. Now, if mataas, the higher the prevalence of the disease, the higher the positive predictive value of the test. Okay. So, example, the absence of valvular calcification in an adult suggests that severe valvular aortic stenosis is not present. This means that valvular calcification is or has letter. So this is your letter A, sensitive siya. Diba? Pag sensitive, you can rule out. So, ayan, yun sinabi. Walang valvular aortic stenosis. So you can rule out. Again, pag sensitive yung test, one that is positive in most patients with the disease, if absent yung characteristic feature na yon, then you can rule out. Remember, sensitivity rules out. Okay, so kindly read this and compute for the prevalence rate of dengue. I'll give you a minute. All right, so what's the answer? Prevalence rate of dengue is 1% lang, di ba? Next, what is the proportionate mortality rate of dengue? O, ilan yung namatay? 50 divided by 985, that is 5%. Next, what is the case fatality rate of dengue? So, ilan yung namatay? 50. Total people who had dengue, 2,000. So, 50 divided by 2,000 is 2.5. You multiply it by 100, guys, ha? Next, all of the following increases prevalence rate. Oh, it increases prevalence rate except high case fatality rate, diba? So, pag sinabi mong prevalence, number of new and old cases. Which graph is suitable to be used to show the increasing cases of dengue from 2009 to 2015? Line graph. Kahit nakapikit kayo, alam nyo yan. Diba? So, prevalence is old and new cases, usually for people with chronic conditions. Okay? It is the total number of cases in a population at a given time. Pag sinabi mong incidence, guys, new cases lang siya. And usually, it is for acute conditions. So ito, sinama ko lang siya so that when you review your pearls handout, meron kayong, quick browsing ng mga rates, fertility rates, natality rates, morbidity rates. Yan. For quick review. So, what is the top 10 leading cause of morbidity in the Philippines? So at least kailangan alam niyo yung top 3. If you want to memorize top 5, that's okay with me, but you have to know it. So for the top 3 leading causes of morbidity is acute respiratory infection, ARI, then hypertension, and animal bites. Kaya kung mapapansin nyo, kahit ang daming cardiologists, di ba? Marami pa rin silang pasyente kasi marami talaga may hypertension. Yan. How about this? The leading cause of death in the Philippines in 2020. Leading cause of mortality naman is ischemic heart diseases, neoplasms, and of course, your cerebrovascular accidents. So this is a little bit more recent. So the top 3 is ischemic heart, cerebrovascular, and neoplasms. Same lang, no? Nagbabago-bago lang siya. But heart diseases are always there, up in the top 3. So for your infant mortality rate naman, the highest is pneumonia, then bacterial sepsis of the newborn, and then your RDS. Okay, so it's usually pneumonia. Question. You're reading a population study that reports 90% of people with lung cancer are smokers. 30% of the people without lung cancer are also smokers. Given this information, what is the specificity using smoking as a predictor of your lung cancer? Okay, so the correct answer here is letter D, 70%. You're reading a study that compares cholesterol levels in children whose father died from an MI with cholesterol levels in children whose father died from other causes. The p-value obtained in the test was less than 0.001. So what does this value indicate? Is it A, B, C, D, or E? So the correct answer here is letter E. If the null hypothesis is true, there is less than 0.1% probability of obtaining a test statistics equal to or more extreme than the one obtained. Yan. So the p-value tells us how likely it is to get a result like this if the null hypothesis is true. Okay, so the p-value for any hypothesis test is the level at which we would be indifferent between accepting or rejecting the null hypothesis, given the sample data at hand. It can also be thought of as the probability of obtaining a test statistics as extreme or more extreme than the actual test statistic obtained given that the null hypothesis is true. It does not reflect the absolute difference of the data between groups about and the correctness of data in the sample. Okay, so let's explain. So null versus alternate hypothesis. So what is the p-value? Okay, give let's give what do you call this? A p-value. Okay. So let's say yung null hypothesis mo is a fair coin. So let's just get this. For example, this is a fair coin. Hindi kita. So let's just say it's a magic trick. Charot. So ang null hypothesis mo, guys, paano mo masasabing null hypothesis siya? Masasabi mong null hypothesis or HO ang isang bagay if it is normal, if it's not the weird conclusion about the stuff, or it is not boring. Okay? So pag HO, ang HO natin here is your fair coin. So that is usually acceptable. Fair coin yung hawak ni Doc Lala kahit na medyo invisible para sa inyo. Okay, so that is the null hypothesis. Your alternate hypothesis or your HA. Okay, your HA is that I would be holding up a trick coin. Okay, si Doc Lala may hawak na trick coin. That is your alternate hypothesis. Okay? So now, since hindi nyo nakikita siya, we will just make observations. So, observations are, your p-value at this time, assuming that the null is true. Okay. So, ihahagis ni Doc Lala yung coin na very invisible para sa inyo. And then, I will say na yung lumabas dito is heads. Okay? So, yung first observation natin is heads. Assuming na, 50-50 siya, we get a 0.5. Diba? 0.5 yung first observation mo. Next, hagis ko ulit. Okay, wait. Sa 0.5 na yon, are you likely to accept your null hypothesis na fair coin yung hawak ko? Yes, di ba? Parang, ay, oo, fair coin yan kasi 50-50 naman yung hagis mo. Tapos, medyo acceptable naman kasi heads yung lumabas. Next. Hagis ko ulit yung coin and then I flip it over. Heads ulit yung lumabas. Now, this is my second observation. So, ilagay nyo, second observation is 0.25%. Kasi yung kanina 50-50, hatiin mo yung 50-50, it's 0.25. Diba? So, ngayon, na 0.25%, heads pa din yung lumabas, will you be likely accepting my my hypothesis? Okay? Yes, di ba? Pwede pa rin naman. Dok Lala, 2 heads lang naman yung lumabas, di ba? So yes, that is still a fair claim. Okay? Hagis ko ulit. Alright, and then taob natin. My third observation is, it's a heads. Guys, heads pa din yung nakuha ko. Okay, now, anong percentage na nito? So, 25 divided by 2, that is 12.2, diba? So, 0.2, 0.12. Okay, so for the third observation, 0.12, naniniwala pa rin ba kayo na this is a fair coin? Yes, pwede pa? Oh, meron pa. May mga naniniwala pa. So, naniniwala pa siya na fair coin pa to on my third try. So, you still believe in the null hypothesis. So, ulitin natin. Oh, inulit ko. And guess what? Ang lumabas. It is your heads pa din, di ba? Now, heads pa din yung lumabas on my fourth try. So, that is what observation na yun? 0.06. Very good. Kasi 0.12 divided by 2 is 0.06. Now, naniniwala pa ba kayo na fair coin itong hawak ko? Meron. Meron pang naniniwala na fair coin. Likely, Doc, na pwedeng tama yung hypothesis mo na fair coin. Pero parang I'm leaning on the trick coin. Diba? Parang naisip mo, I'm leaning on the trick coin. So now, what do we do? Guys, ganun talaga. Kasi, if your observation, okay, falls below 0.05%, you start to think that the null hypothesis is wrong. Okay? Because it is unlikely, very unlikely to happen randomly that you will get heads. Diba? Heads. So if the null is true, it becomes peculiar now. Okay? So, isipin nyo yun, very unlikely to happen randomly. Pero, gusto ko pa i-prove eh. I want to prove a point. Ulitin natin. So, this is my fifth time. So, pag fifth time, okay, that is now your 0.03. Okay, 0.03. It's still heads. Oh my God, heads pa rin yung nakuha ko. So, naniniwala pa ba kayo na fair coin to? Or naniniwala kayo na parehong heads yung hawak? Yung parehong heads yung coin? So, which are you more leaning to ngayon? The fair coin or the trick coin? The trick coin, di ba? Parang very unlikely na that to happen randomly. So, ulitin natin just to make point. Okay? So, my sixth observation is still heads. Diba? So, that is 0.01. 0.01 na siya. Napakababa na ng p-value mo. Okay? So, what happens? Pag mababa ang p-value mo, you now reject the null hypothesis. Diba? So, if your p-value is very low, you now reject the null hypothesis and you start to accept the alternate hypothesis. Okay? So, do you get my point? Usually, we believe the null hypothesis. But, if it is below 0.05, okay, we start to accept the alternate hypothesis because whatever is happening, okay, it's very unlikely to happen at random. So, yun lang yun. Yun yung p-value, yun yung importance of your p-value and accepting the null and rejecting the accepting the null or not accepting the null hypothesis. So, yan yun. So, hopefully, medyo naiintindihan nyo na siya. Next. Okay, so in country A, there are 35 new cases of breast cancer per 100,000 adult women per year. In country B, the number is 90 per 100,000. Which of the following is the most likely explanation? So is it A, B, C, or D? So guys, this question came from your pretest. No, women in country A are younger, so this is the answer. So the most important risk factor for the development of breast cancer, like any cancer, is age. Okay, but it's still the most common cancer for women, yung breast cancer. Ang nursing, okay, it has a protective effect on breast cancer, but it's nowhere near the magnitude of the effect of age. Cigarette smoking, not a major risk factor for breast cancer. And of course, early diagnosis, if it had any effect, it would be expected to increase the incidence rate. Diba? So Susie is pregnant. How many calcium tablets would you recommend her to take per day? I don't know, randomly tinanong to sa Prevmed, but I know dapat sa, sa OB, diba? So it's 2 pieces of 500 milligram tablets. Pag pregnant, diba? And you also tell them to drink folic acid before they want to conceive or start a pregnancy. And then, yun, calcium. May calcium. And then after calcium. And if nasusuka sila sa iron, you can always change the brand. Okay, so pag mas mahal yung iron tablets, mas less yung side effects, mas nagugustuhan ng patient. So, if let's say, parang sinasabi nila, nasusuka po ako, doc, change the brand. This is true with any medications. No? So, the more expensive brands have less side effects. Next. Oh, sorry. Lumabas na siya. So, which of the following is the most appropriate next step? It is your discontinue the OCP and recommend a barrier method. Sorry, lumabas na yung sagot. Okay. A 29-year-old woman with type 2 diabetes mellitus is asking you about progestin-only pills, yung POP, as a method of contraception. Which of the following is true? Letter E. So progestin-only pills should be taken every day of the month without a hormone-free period. A 28-year-old monogamous married woman comes to you for emergency contraception. She and her husband typically use condoms to prevent pregnancy. But they had sex approximately 36 hours ago. The condom broke. She does not want to start a family at this time. Which of the following statement is true regarding the use of your emergency contraceptive pills or your ECPs? It's letter C. There are no medical contraindications to the use of ECPs other than allergy or hypersensitivity to the pill component. Pero sa Pilipinas, hindi po ginagawa ito masyado. Okay. The number of consult of respiratory illnesses in Tondo versus those in Global City is discrepant to the national statistics of the Philippines. Based on this data, we can use letter A, B, C, or D. So the correct answer here is letter A, inverse care law. So inverse care law was proposed by Julian Tudor Hart in 1971, 47 years ago. 48 years ago in the south of Wales. The availability of good medical or social care tend to vary inversely with the need of the population. Need of healthcare and actual utilization. So, ano ibig sabihin nun? Kung sinong may kailangan ng healthcare, siya yung hindi nakakatanggap. Okay? Or nagpapatingin. At yung mga hindi kailangan, ang mas nagpapatingin at tumatanggap ng healthcare. Now, why is that? These are due to your income inequalities and access to your healthcare. But ano ginagawa ng government? Di ba, papadala tayo ng doctors to the barrios. So, that's our way of, answering this problem. This term refers to the separation of the sick people in the population to those with a contagious disease from people who are not sick. This is your isolation. So ito yung final rule actually, sinasabi lang dito na limited to 72 hours yung amount of time that an individual may be apprehended pending the issuance of a federal order for isolation, quarantine, or conditional release. So, 72 hours ka lang pwedeng i-hold for, quarantine. Which of the following is true about the epidemiology of appendicitis? Is it A, B, C, or D? The correct answer is letter D. Affects 1 in 1,000 pregnancies. So, appendicitis is an important cause of morbidity in the Western world, but mortality is decreasing. Boys and girls are nearly equally affected, and it's most common in the second and third decades of life. During pregnancy, displacement of the appendix by the uterus can make diagnosis very difficult. Okay, kaya mahirap i-detect sa pregnant women. Okay, so what is, for example, right lower quadrant pain with palpation of your left? What do you call that sign? Okay, this is your Rovsing sign. So this is usually due to your peritoneal irritation, diba? How about right lower quadrant pain with internal and external rotation of the flexed right hip? This is your obturator sign, diba? This is deep in the right hemipelvis, kaya masakit. How about right lower quadrant pain with extension of the right hip or flexion of the right hip against resistance? This is your psoas, diba? How about naubo ka? Masakit dito. Okay, this is your Dunphy sign. This is your localized peritonitis. Okay, the bacteria that are involved in nosocomial infections are transmitted most often by A, B, C, D, or E. Hanggang D lang. It is your direct hand contact. Syempre, di ba? So, transmission of bacteria from patient to patient most commonly occurs via the hands of hospital personnel. Hindi naman sinabing doktor. Hospital personnel lang. Di ba? Airborne transmission, indirect exposure, and common source exposure, much less important than direct spread. And of course, your indwelling catheters, important risk factor, but not sources of transmissible infection. Which of the following will highly decrease transmission of nosocomial pathogens? This is your meticulous hand washing pa rin, guys. Which of the following is the most common site of your nosocomial infection? Nosocomial? Genitourinary tract. So as you can see, the genitourinary tract infection is 40%, no? In the hospital, and 20% next is your surgical site infection, followed by your lower respiratory infection, followed by cutaneous infection, followed by others cutaneous, and then bacteria transmitted by your IV catheter. So, UTI pa rin ang highest bago yung surgical site infection. Which of the following is not included as part of... Bakit UTI? Nga pala. Kasi diba sometimes when you're in the hospital, hindi umihi yung mga patients or tinatamad bumangon from the bed kasi they're feeling pain, masakit. No? So nagkakaroon ng stasis of the urine. Tapos hindi pa sila masyadong umiinom, all kinds of problems. Which of the following is not included as part of shades and roles of a 5-star physician? Very good. Letter C, advisor. So a 5-star physician, healthcare provider siya, teacher, educator, scientist, researcher, administrator, manager, and of course, social mobilizer. Remember that, guys. Know it by heart. Okay, so this is your impairment, disability, and handicap. Asked a few years ago, no? So, pag sinabing impairment, guys, it is loss or abnormality of psychological, physiological, or anatomic structure or function. So, ito yung nakikita ng doctor, ito yung dinadiagnose ng doctor. Impairment siya. Now, when you label a person disabled, be very careful. No, kasi they can claim disability benefits. So, disability is a restriction in the ability to perform a function that may result from an impairment. This is the patient's experience of her disease. Ito na, may kinalaman na ito sa patient. Okay? Because other people, for example, meron silang disability, but they don't feel na, alam mo yon, hindi nila kayang gawin, they can still do it. But some patients feel na, ay, hindi ko kayang umakyat na hagdan. But some people, they don't feel that. We call handicap. Handicap naman is the disadvantage that results when the disability or impairment limits or prevents the fulfillment of a role. So, nagiging sickness siya if socially defined condition that applies to people who have a disease or illness. So, parang dahil sa handicap niya, hindi siya maka-participate or na-exclude siya. Parang ganon. So, let's go to the example. So David, 4-year-old, who has a form of cerebral palsy called spastic dysplegia. David's CP causes his legs to be stiff, tight, and difficult to move. He cannot stand or walk. So please identify the impairment, the disability, and the handicap. So the impairment is the inability to, move legs easily at the joints and bear weight on the feet. Disability, yung inability niya to walk. And of course, yung handicap prevents him from playing sports or doing certain activities that a 4-year-old can do. So, yan yung meaning, okay? Impairment, disability, and of course, your handicap. So let's go to the family. May mga definitions of family. Generally, a group of people who are related to each other, either biologically, emotionally, or legally. Pag sinabi mo extended, Pag sinabi mo by affinity naman, a group of people related by blood, marriage, adoption, or who live together in a household. Pag sinabi mo structure, function, composition, and affection, ito yung mga small social system made up of individuals related to each other by reason of strong reciprocal affection and loyalties and comprising a permanent household. So ito yung, for example, yung mga Amish communities, like for example, if you consider yourself a family, like top-notch family, ganyan, alright? So by structure or function, meron kayong paninindigan, okay? So let's go to the nuclear family. This is just parents and, dependent children. Nakaseparate yung dwelling dapat, and they are financially independent. Pag extended family, these are your parents, children, and relatives, aggregates of families, or part of families from 2 or more generations occupying a single or adjacent dwelling. So, pwedeng single or pwedeng magkatabi ng bahay. Okay? Single parent families, children less than 17-year-old living with a single parent. This could be dahil yung father is like in jail, namatay yung spouse mo, separation, iniwan ka, desertion, out of wedlock, or one parent working abroad. So, single parent family yan. Pag sinabi mong blended family, includes step-parents and step-children. So, dalawang girl, boy, pareho may anak, okay, then nag-remarry. This is usually due to divorce and annulment with remarriage. Now you have your communal or corporate family. Different families formed for specific ideological or societal purposes. Frequent considered as alternate lifestyle for people who feel alienated from a predominantly economically oriented society. So, example nito yung mga Amish community in Lancaster, Pennsylvania. Yan. If a patient is dressing differently or drastically changing his or her hairstyle, what form of communication is this? So, ano yung gusto niya ipa-perceive sa iyo? So, the answer here is symbolic. So, a family life cycle, it represents a composite of the individual developmental changes of family members. Presents a cyclic development of the evolving family unit and shows the evolution of the marital relationship. So, ito yung mga stages. Unattached yung adult, kayo yun. Okay, leaving home, accepting emotional and financial responsibility. Oh my God, magtatrabaho na kayo, guys. You will be part of the society, the working society. And of course, differentiation ng self mo in relation to the family of origin. And then now, you go into the newly married couple. Okay, joining of families through marriage, commitment to the new system, and realignment of your relationship with extended families. So, once you guys get married, okay, your family will now be you and your husband or your wife. And of course, yung mga children nyo. No, but that is your family. Now, your parents, your siblings, they become your extended family. So, you have to remember that, no? Kasi maraming marriages ang nagbe-break dahil dyan, no? Nakikita na sa in-laws, which, it's nothing bad with that. But, I always tell them na, guys, kung kayong ang dalawa nag-aaway, di ba? And you're starting a new unit, you have to separate your dwelling. Best to separate your dwelling. So that, you guys can start off. And even if you fight, wala mo siya na makakakita, makakaalam, di ba? Or walang pwedeng makisali. Ganyan. So, family with young children, accepting new members into the marriage and extended families, diba? So, joining in child rearing, financial, and household tasks. So, once you have children, kasi sometimes when people get married, hindi pa kayo nag-join ng finances because both of you're working, and you don't really think of joining your finances. But in the long run, you combine your finances, especially when you have children, no? Sabi nga nila yung money daw ng husband mo is your family money, but your money is yours. Parang ganun, charot. Okay, so that is family with young children. Now, families with adolescents, this is a little bit more trickier because for adolescents, you have to increase your flexibility to include your child's independence. And not only that, you have to include the grandparents' frailties kasi dito na nagkakasakit ang kanilang mga grandparents. Okay, so you refocus on your midlife marital and career issues. The next is your launching family. So launching of your children and moving on. Accepting exits and entries from the family system. So sometimes your children want to be left alone, but sometimes they want, to join you. So that's okay. Development of adult-to-adult relationships between grown children and their parents. So families in the later life, accepting the shifting of generational roles, maintaining own function in face of psychological decline, and support for a more central role of the middle generation, dealing with the loss of spouse, siblings, peers, and preparation for your own death, life review, and integration. Little bit sad, but, dadating din dyan. Now, question. Kindly read the question and I'll give you the answer. Again, so what stage is he in the family life cycle, family illness trajectory? So he's stage 5, adjustment to the permanency of your outcome. This is the most challenging and rewarding stage for the physician in the family illness trajectory. So ano to? This is your major therapeutic efforts. So tandaan nyo guys, this is the first stage, onset of illness, wala pa kayo doon. Okay, walang physician dyan. Stage prior to contact with the physician, and medical beliefs and previous experiences provide influence to the meaning of your illness. So for example, may ubos sipon siya, uminom siya ng medical before, gumaling siya. Ngayon, yun lang yung belief niya. If I drink medical, I will get better. Okay? So, wala pang physician sa onset of illness to diagnosis. Next. Yung stage 2 is the impact phase or your reaction to diagnosis. Dalawa yung phases niya. Merong emotional plane and your cognitive plane. Of course, your emotional plane is emotional. Denial, disbelief, and anxiety. No? Followed by emotional upheaval, anger, anxiety, and depression. And the last is accommodation or your acceptance ng situation. That is the emotional. Pag sinabi mong cognitive, okay, may phases din yan, 1 to 4. Yung phase 1, tension and confusion. Phase 2, repeated failure in deriving a diagnosis. So medyo napafrustrate yung mga family members. Phase 3, okay, so nagiging receptive na yung family members to the new approach sa distress. And phase 4 is eventual acceptance. So tandaan nyo, yung end is laging acceptance. You as a physician, you should anticipate the number of problems and help families cope and adapt to the situation. Okay? You also interpret findings which are oftenly misunderstood. Example na lang yan is yung parang high blood pero anemic. Oh my God, pagka sinasabi talaga ng mga patients yan, talaga nag-explain talaga ako ng mahaba, okay? So, you tell them, iba po yung anemia, iba po yung hypertension, iba din naman po yung low blood, okay? So, yeah. Next. So, ito na, stage 3, major therapeutic efforts is the most important part. Okay, and you have to remain open with the family and just help them. So ito naman yung stage 4, early adjustment to outcome and recovery. So there are 3 types of anticipated recovery or outcome: return to full health, partial recovery, so may mga remnants pa siya, and of course, permanent disability, which now requires acceptance. Okay? So, yan yung 3 types of anticipated outcome. So you as the physician, you have to deal with the immediate effects of trauma, alleviate anxiety, give psychological support, and explore the level of understanding of patient and the family. Kasi syempre dito, sa early adjustment, from the role of being sick to some form of recovery and adaptation. Diba? Kasi yung iba, gusto sick lang talaga sila forever. Kasi, diba, their family members visit them. Kasi if you're old and frail, sometimes wala ka ng family member na kasama sa bahay, diba? And sometimes, pagka nasa hospital ka, nandiyan lahat ng anak mo, nandiyan lahat ng apo mo, you're much happier. Even though you're in the hospital. Okay, so stage 5 is the adjustment to the permanency of outcome. Okay, so you have to assist the family and the relatives in adjustment to the permanency of the outcome. And remember, they should accept it. Okay. So question, which of the following parameters in the APCAR measures the satisfaction with the commitment made by other members of the family? Is it A, B, C, D, or E? So the correct answer here is letter E, your resolve, diba? So how about this? A moderately dysfunctional family will have an APGAR score of moderately dysfunctional 47. Okay, so what is the scoring? 8 to 10 is your highly functional family. 4 to 7, moderately dysfunctional. And of course, your 0 to 3 points, severely dysfunctional. Okay. A dysfunctional family, meron siyang chronic inability to respond to the members or cope with changes and stresses in the environment. So, hindi sila nakaka-adapt sa changes or sa stress. So, ito yung meaning ng APGAR. A is for adaptation. The capability to utilize and share inherent resources, which are either intrafamiliar or extrafamiliar. Partnership is, of course, solving problems by communicating, sharing of decision-making. So, pag decision-making, partnership yon guys. Kasi minsan iniisip mo, asan yung decision-making? Sa partnership siya. Freedom to grow and change, physically and emotional growth. Intimacy and emotional interaction with the family is your affection, and resolve is the member's satisfaction with the commitment made by other members of the family. Okay, so that is your APGAR. Okay, in the family genome, what symbol is used for the female? Is it A, B, C, D, or E? So the correct answer here is letter C, circle. So these are the genogram symbols. It's a square for male and a circle for female. So I think other symbols, okay, transgender, female to male, transgender, male to female, for gay, lesbians, and of course your bisexuals. All of the following are included in the RA 9288 newborn screening, ideally done during the 48th to 72nd hour of life, except is it A, B, C, D, E, or F? The correct answer here is letter B, congenital adrenal hypoplasia. Bakit? Kailangan hyperplasia siya, diba? So, it's your CAH. Guys, paano mo matatandaan itong 90 to 88? So, imagine that this 88 are two babies na nakaswaddle. Okay, lagyan nyo sila ng mata, a little cute, diba? So, 90 to 88 is your newborn screening act. Okay, so according to the WHO, the leading cause of mortality worldwide for both men and women is, we discussed this kanina, this is your ischemic heart disease, letter boy. Totoy has a history of cryptorchidism. Knowing Totoy is a male, he is most likely to develop what type of cancer, A, B, C, or D? The correct answer here is testicular cancer. So, remember guys, undescended testis pag 20 to 30 years old ka na. Okay? It usually becomes testicular cancer. The incidence of cholelithiasis is increased in all of the following conditions except letter A, hypercholesterolemia. So gallstones are extremely common in about 20% of women and 8% of male above 40. Although most gallstones contain cholesterol, hypercholesterolemia is not associated with an increased risk. Diabetics have an increased risk for gallstones as well as morbidity and mortality associated with the disease. Chronic hemolysis causes calcium bilirubinate, and other risk factors like age, obesity, chronic biliary infection also play a part. There has been increasing age-adjusted mortality in the past 25 years from cancer of the lungs. So dati lungs, hanggang ngayon lungs pa din, guys. Okay, so lung cancer and then pancreas, and then this is probably because of cigarette smoking. So mortality from uterine malignancy has declined mainly due to the acceptance of your pap smear. Cigarette smoking increases the risk of acquiring cancers of the following except cancer of the liver. Diba? Ano yung nakaka-cause ng liver cancer? It's your HBV or HCV infection. So hepatitis B or hepatitis C, okay, infection causes liver cancer. The most common site for cancer in females in developing countries is the breast, diba? Developing countries, cancer, female, breast. So ito yung mga leading new cancers and deaths noong 2013. So, pag estimated new cases, it's prostate, lung, colon. Pag female, breast, lung, and colon. Pag estimated deaths, lung and bronchus for both. For male, it's prostate. For female, it's breast. And colon and rectum for the third. So, what is a common occupational disease? Most common. Okay. It's dermatitis. I know maraming magre-react na parang, Doc, hindi. It's muscle problems, skeletal work-related problems. Well, that is true. Okay, that skeletal work-related problems are the most common occupational disease. Yung most common seen in the emergency room or in the clinics are your dermatitis. Why? Kasi yung mga skeletal work-related problems, nare-report siya in the workplace but not in the clinics kasi umiinom na yung mga personnel ng ibuprofen, paracetamol, naglalagay ng salon pass, alright? And they don't usually go in for these type of problems. So, hindi siya na-list. Okay? But if you have dermatitis, if they have skin conditions, medyo pangit talaga yung hands or something, they really seek medical attention. So the most serious manifestation of lead intoxication is lead intoxication, letter, cerebral edema, often noted with blood lead levels exceeding 100 micrograms. So the major environmental source of lead absorbed in the human bloodstream is air, guys. Kaya, di ba kung mapapansin niyo yung mga gasoline, lead-free na sila ngayon because inhaled lead is 50% absorbed versus your GI lead which is only 10% absorbed. So pag kumain ka ng lead-based, di ba dati yung mga walls, lead-based yung paint? So pag kinain mo yun, alright, 10% lang siya. So the most commonly described anomalies associated with your congenital rubella syndrome include all of the following except letter, dog, your Huntington's teeth. Saan yun nakikita? Sa syphilis, diba? So for your congenital rubella, meron kang ophthalmological, cardiac, auditory, and neurological abnormalities. Your congenital syphilis, yan yung Huntington's teeth, okay? Syphilis is caused by your anong organism? P, pallidum, diba? And infants born to syphilitic mothers usually have saddle nose, saber shins, Cloton joints, and mulberry molars. Okay, so ito yung mnemonic mo for your congenital rubella syndrome. So you have your 5 Bs, okay? So I like to say it as bulag, bobo, bingi, butas ang puso, and your blueberry muffin baby. But of course, you have to remember na pag sinabi mong bulag, it's cataract. Pag sinabi mong bingi, it's sensory neural deafness. Pag sinabi mong bobo, it's mental retardation. Pag butas ang puso, it's PDA, okay? So remember that mnemonic for your congenital rubella syndrome. Okay, eruption of the first deciduous tooth happens at 6 months of life, diba? The eruption of your first permanent tooth usually happens around permanent tooth 6 years of life. So, tooth emerges at 8 to 12 months, okay? When tooth fall out, 6 to 7 years. Yung inyong central incisors. Okay? The most prevalent mental health disorder in children is, this is your letter C, behavioral problems. Okay? So, behavioral problems, including ADD and learning disabilities, occur in approximately 10% of children, and 10%. Autism, 0.05%. Mental retardation, 1% lang siya. So, ADD is common. Anong treatment na ADD, guys? It's your Ritalin, diba? Or your methylphenidate. So, parents who abuse their children are correctly characterized by the following statements, except, boy, they're likely to be men than women. Bakit? Okay, so the mother is more commonly the abuser, perhaps because of greater contact with the child. So abusing parents are usually psychologically immature and have poor impulse control. So pag sinabi mong abuse, it's not really physical abuse, 28% lang yan. But sometimes it's also neglect, 34%, and sexual abuse, 30%. Anabolic steroids used among adolescents is associated with all of the following except letter A, enhanced school performance. Why? Because school performance deteriorates as a result of mood changes and aggressive behavior brought about by this steroid use. All of the following statements are true of your tuberculosis except letter C. The time from infection to the development of positive tuberculin skin test is about 6 months. So, pag nag-PPD tayo, guys, ilan nga siya? 48 hours, papabalikin mo, and then after 72 hours again, di ba? If the PPD is 5 millimeter or more, okay, for example, AIDS patients or immunocompromised patients, then that is already considered positive, di ba? There's something in my eye, I don't know. Okay. So kindly answer this. I'll give you a few minutes to answer it. All right, let's go to the answers. So you have your dengue, yellow fever, chickenpox. This is letter D, viral infections. Scabies, measles, shigellosis. This is person-to-person spread. Rabies, taccosis, salmonellosis is letter B, salmonellosis. B, zoonosis. And of course, walking pneumonia, brucella streptosis, letter A, bacterial infections. Which of the following is considered the single most important preventive measure against diseases? Water sanitation. Letter boy. In waste management, what is the color for biological waste that includes unused sharps and pressurized containers? This is letter A, red. Okay, so ito yung biological waste natin. Black is non-infectious dry waste. Green is non-infectious wet waste. Yellow is infectious and pathological. Pero pag yellow with a black band, ibig sabihin radioactive chemicals, waste including those with heavy metals pala, heavy metals. Pag orange, yung radioactive. And red, sharps and pressurized containers. Okay? So true statements regarding your Haemophilus influenza type B include all of the following except it is the most common cause of acute otitis media in children. Ano ba yung most common cause of acute otitis media in children, guys? Sabay-sabay, it's strep pneumonia, diba? That's the most common cause of your acute otitis media in children. So Hep B, Haemophilus influenza B, it can cause meningitis, epiglottitis, pneumonia, periorbital, or facial cellulitis, mainly in children, but it is only the second most common cause of acute otitis media in children. Okay? So tetracycline is contraindicated in pregnancy. What alternative drug will you give to cover for the coexisting chlamydial infection? This is your azithromycin, diba? Effective means of preventing trichoneurosis in humans include letter B, prohibiting the marketing of garbage-fed hogs. Bakit? Although pwede to, guys, prohibition of marketing of garbage-fed hogs is easier to enforce than inspection to ensure that all garbage is properly cooked. Okay? So, yan siya. Ensure that all garbage and offal fed to hogs are heat-treated to destroy the cyst or preferably by using feed devoid of animal meat. So, in short, parang bawal pa kainin ng kaning baboy ang baboy just to prevent infection kasi ang hirap i-check, no? Thoroughly cook at temperature of at least 77 degrees Celsius to destroy the cyst, and of course, freezing. Okay, characteristic signs and symptoms of kwashiorkor include all of the following except your loss of subcutaneous fat. Saan nga ito nakikita? Sa iyong marasmus, diba? So this is the difference. This is the kwashiorkor on your left, the marasmus on your right. Pag marasmus, it's hapis na hapis, payat na payat. But for your kwashiorkor, you have a big abdomen, right? Dominador was in a mass accident and sustained an extensive wound to the thorax, affecting the vena cava. As a triage officer on the scene, what color would you give him? Mass accident to, ha? This is color black, all right? Anne was also involved in the mass accident but only sustained minor injuries. What triage color would you give her? Minor injuries, it's white, diba? So red tags are immediate, are used to label those who cannot survive without immediate treatment but who have a chance of survival. Now, kanina is a black tag kasi expectant na siya. Are used for the deceased and for those whose injuries are so extensive that they will not be able to survive given the care that is available. Now, for white tags, those with minor injuries lang siya, doctors are not required. Green tags are reserved for the walking wounded, and of course, yellow tags for observation. Okay, and possible red triage for later. So, can we answer this? Petechia, sorghums, hematuria, and bone or joint pain is considered letter C, vitamin C deficiency. DDD, dermatitis, diarrhea, delirium is letter E, niacin deficiency. Edema, neuropathy, and myocardial failures due to your thiamine deficiency. And of course, your cirrhosis, conjunctiva, hyperkeratosis, and keratomalacia is letter A, vitamin A deficiency. Answer this. So pag sinabing poor mineralization of bones and teeth, osteoporosis, this is your calcium, diba? Letter E. Nausea, diarrhea, muscle cramps, and dehydration, this is your sodium, letter T. Tendency towards dental caries is your fluorine, and dwarfism, hepatosplenomegaly, poor wound healing is letter C, zinc. Lung fluke disease is letter it's letter D, diba? Schistosomiasis is letter A, snail. Toxocariasis is letter E, dog. And cysticercosis is letter B. So kindly answer this. I'll give you a moment. Pag nag-unmute ako talagang nag-aano siya, no? Okay, so disability is permanent, irreversible, and stabilized. This is letter C, tertiary. Immunizations, primary prevention. Checking for cuts and blisters on the foot of diabetics. C, tertiary. Encouraging regular checkups, secondary. BSE, TSE, mammography, this is letter B, secondary prevention. Optimal reconstitution, this is letter C. Regain high-level wellness, this is letter C. Environmental sanitation, letter A. General nursing assessment at the hospital, community, and at the home, B. Prevention of accidents, letter A. Health education on balanced diet, letter A. And your taking of medications for hypertension, letter C. All right, next. Vaccinating a healthcare worker against hepatitis B, this is Letter C, specific. Giving isoniazid for 1 year to a 28-year-old medical student whose results in the tuberculosis skin test using PPD recently converted from negative to positive. This is your secondary prevention. Performing carotid endarterectomy in a patient with transient ischemic attacks. Tertiary prevention. Recommending regular physical activity to a patient with no known medical problems. This is your letter A, health promotion. Okay. The administration of human immune globulin after exposure to hepatitis B is an example of your letter dog, passive immunity. Which vaccine would most likely be dangerous to a person with immunodeficiency? Is it A, B, C, D, or E? Correct answer is letter C, measles vaccine. An example of secondary prevention is it A, B, C, D, or E? Letter A, a detection and treatment of hypertension. A screening program is designed for the early detection of lung cancer after a clinical study showed promoting results. The survival time from diagnosis in individuals whose lung cancer was detected by screening is found to be 3 months longer than the survival time in individuals who did not undergo screening and presented with symptoms of lung cancer. This difference is most likely due to your what? A, B, C, D, or E? The correct answer here is letter C, lead time bias. There is a controversy regarding the use of prostate-specific antigen, or your PSA, to screen for prostate cancer because letter A, B, C, D, or E. Correct answer here is letter D. The appropriate management of asymptomatic prostate cancer is uncertain. What is an example of tertiary prevention? Is it A, B, C, D, or E? Correct answer here is letter B, occupational therapy after a stroke or a CVA. A disadvantage of using only the total cholesterol level to predict the risk of CVD is A, B, C, D, or E. Correct answer is letter A. HDL is included in the measure. Bakit? HDL levels are inversely related with your cardiovascular disease, diba? All other modalities, moieties are directly related. Okay, let's move to primary healthcare. So, primary healthcare is an essential healthcare made universally accessible to individuals and family in the community by means acceptable to them through their full participation and at a cost that the community can afford. It forms an integral part both of the community's health system, of which it is the nucleus, and of the overall social and economic development of the country. This is from the Alma Ata Declaration. So the 4 pillars of your primary healthcare is active community participation, intra and intersectorial linkages, use of the appropriate technology, and support mechanism made available. So the goal of your PHC is equal access to healthcare and, of course, self-reliance in health. This type of PHC worker refers to physician with specialties, nurses, dentists, and pharmacies. Okay, so what now yan? What type of PHC? It is your first level personnel. So the elements in your primary healthcare, E for education, L for locally endemic disease control, E expanded program on immunization, M maternal and child health and family planning, E environmental sanitation and promotion of safe water supply, N nutrition and promotion of adequate food supply, G treatment of communicable disease and common illnesses, and of course S is your supply of essential drugs. I'm pretty sure first year medicine na memorize niyo yan, so I'm asking you to revisit that again. So these are the strategies, no? So government-private sectorial partnership, integration and prevention, curative measures, intersectorial linkages, use of village health workers, cooperation with traditional health system, and of course, community organizing. So ano ba tong community organizing? This is your COPAR, diba? Community organizing, participatory action in research. So ito yung parang, and you get a apathetic community, mga voiceless people, and you get them to be politically responsive in the community. So community organizing participatory action research is an integral tool in community development following a systematic and cyclical process. It facilitates education of the people. Okay, it nurtures the ability of the society to organize themselves. It is for the people, organize themselves. COPAR is an important tool for community development and people empowerment, as this helps the community workers to generate community participation in development activities. So it prepares the people to eventually take over the management of a development program. So when you go to the community, diba, gagawa kayo ng program, but of course, the people have to take over these. All right, so COPAR maximizes community participation and involvement. So principles of COPAR: people, especially the oppressed, exploited, and deprived sectors, are open to change and have the capacity to change and are able to bring about change. COPAR should be based on the interest of the poorest sectors of the society and not your interest, okay? Yung kanilang interest. COPAR should lead to a self-reliant community and society. That is the end goal, okay? Self-reliant community and society. So what process do we use? It is a progressive cycle of action, reflection, okay, which begins in small, local, and concrete issues identified by the people. So meron kang small issues like cigarette smoking, ganyan. Tapos evaluate mo, magre-reflect sila kung anong pwede nang gawing action. Consciousness raising through experimental learning is central in the COPAR process because it places emphasis on learning that emerges from concrete action and which encircles succeeding action. Okay, COPAR is participatory and mass-based because it is primarily directed towards and biased in favor of the poor, the powerless, and the oppressed. COPAR is group-centered, okay, and not leader-centered. So group-centered siya. Leaders are identified, emerge, and are tested through action rather than appointed or selected by some external force or entity, okay? So masa talaga tong COPAR na ito. Considered the most crucial stage where people are mobilized. So saan to? Formation, entry, organizing, sustenance, and strengthening, pre-entry, or phase out. This is your letter C, organizing. Phase of COPAR, where the core group is created. Saan ang core group? In your formation part, diba? So, phases of COPAR, you have your pre-entry, entry, formation, organizing, sustenance, and strengthening. And of course, you have your phase out. So what is not considered a physical barrier for your GIDA, your geographically isolated and disadvantaged areas? This is letter letter C, class 4 municipality. So ang class 4 municipality is not considered to be physical barrier sa GIDA. Being a class 4 or class 5 municipality would be considered as a socio-economic barrier lang siya. Okay? So pag sinabing class 4, ito yung may annual income of 40 million pesos or more but less than 60 million pesos. So yan yung class 4 municipality. Distance, weather, and transportation difficulties are all physical factors that characterize GIDA. So class 4, hindi siya characteristic. Important RAs to remember: RA 6111 or your Medicare Act, RA 2382 Medical Act of 1959, RA 7719 or your voluntary blood donation. So ito yung blood donation, no? Basically, sinasabi lang yan, na in order for our blood to become safe, adequate, rational blood use, kailangan voluntary ang pag-donate ng blood. So these are your Millennium Developmental Goals by 2015. So supposedly na-achieve na natin yan. And this is the new one. I'd just like you to revisit itong mga no poverty, zero hunger. Okay? Tapos meron tayo dito life below water. So would you want that in the future? Life below water or life on land? Ayan. No? So peace, justice, and strong institutions, partnership for the goal. So yun yung mga development goals by 2030. So these are your mental retardation. Mental deficiency, 0 to 25, 26 to 50 imbecile, 51 to 70 morons. Pag sinabi mo mentally retarded, DSM-5 yan, less than 20, profound, 20 to 34 severe, 35 to 49 moderate, 50 to 69 is mild. So mental retardation is now politically incorrect. The correct term is intellectual disability. So ID na siya, guys, ID. Also called intellectual developmental disorder or ITD. Okay, so huwag ka na magtatawag ng retarded. Hindi na pwede yon. Okay, intellectually disabled. Yan. Intellectually disabled ba ang anak mo? Ganon. Alright, so this is the estimated population. Oh, medyo finish na yan. Dito tayo sa population by gender. Mas marami ang males, 50.5. Females, 49.5. Life expectancy, mas mataas sa female, 74 versus 68 for your male due to health-seeking behavior na characteristic ng female and of course, compliance to the health treatment and medications. So for the age group, pinakamarami is 5 to 14 years old. So DOH program, breastfeeding check, tama, sapat at eksklusibo from birth up to 6 months. Ito, review nyo lang din colors of lividity kasi lumalabas din yan, especially yung mga bright red, cherry red. Okay, yan. If you have time, revisit your CDC website and your DOH websites. Diyan kinuha most of the questions here in your preventive medicine. Okay, so thank you very much for joining me in our preventive medicine and public health, okay, review of your pearls. So, ano bang masasabi ko? Guys, kayang-kaya nyo to. I will be praying for each and every one of you. And I will see you on the other side. Bye!